Apologies for that. I am just trying to figure out how to minimize the screen so I can still look at other things.
Great. Hello, everybody. Welcome or welcome back. My name is Arthi Chari. I'm an infectious disease and public health physician at the Veterans Health Administration. And on behalf of my NIHIS co-chairs, I'd like to welcome everyone back to day 2 of the NIHIS Heat Season Warm-Up Workshop. First, we'll go through some workshop logistics and ground rules. So next slide. Great. This webinar is being recorded and it will be available on the event page on heat.gov in the coming days. The Zoom platform has a maximum capacity of 500 attendees, so if you join or rejoin the workshop after we've reached that maximum number, you will be sent to our YouTube live streaming page, and we have a link to that live stream on heat.gov. We'll also put it in the chat. External recording of this webinar is prohibited. You can't sample segments or sound bites for your own use or the use of your organization. A reminder that while we won't be using the chat during the webinar, we do encourage you to please use the Q&A function at the bottom of your screen to ask questions to our presenters. There will be time for Q&A after every presentation, just not after the keynote speakers. And for those needing American Sign Language interpretation, we have 2 interpreters here with us today that we will spotlight and that you can pin to your screen. All right, with that, let's proceed to day 2, starting with a day 1 recap. I first want to thank the Duke University Nicholas Institute for Energy, Environment, and Sustainability for helping us to host this webinar. Yesterday, we started off with a powerful keynote from Dr. Maddie Orr, who reminded us that, especially with extreme heat's growing impacts to health, industry, and economics, sports can make the issue of extreme heat personal and visible. Promoting safe physiologic and social conditions allow us to preserve the health benefits that sports bring to individuals and our communities. And Dr. Orr emphasized that while we can't avoid hot days, heat illness is absolutely preventable with education, empowerment, and existing solutions, which the rest of our day 1 speakers dove right into. In session 1 yesterday, we explored the nature of the problem, starting with Dr. Falat's fascinating and visual explanation of how heat affects our body's physiology and the significant impacts of heat on at-risk populations. Then Dan Burke from the National Weather Service shared some sobering case studies from large events and festivals in Las Vegas, including planning preparedness measures taken and lessons learned when event organizers and crowds were faced with severe summer heat. He and other speakers emphasized the many factors that contribute to heat illness risk and planning, from temperature, humidity, and feels-like conditions to crowd, individual factors, hydration, shade, surface albedo, airflow, and the level of preparation and communication. Dr. Carl Kim then talked about the sometimes unseen but critical and cascading impacts of heat on our infrastructure and transportation. He emphasized the importance of focusing on at-risk populations, on collaborating with paratransit and emergency medical services, on sharing resources and lessons learned, and taking an all hazards and whole of community approach. Then we heard Dr. Maggie Morrissey's vital research on protecting the workers and volunteers who keep our events and communities running, but who face unique risks from often repeated or continuous heat exposures. She stressed the need for clear prevention strategies in the workplace, including policies and procedures for acclimatization, environmental monitoring, hydration, and shade. Session 2 yesterday dove into the logistics of hosting outdoor events, where we first heard from Sean Simmons about the many microclimates in and around venues. With preparation and communication targeting the factors he discussed, Even simple measures can often have positive impacts on guest comfort and well-being. This complemented Chris Furman's practical recommendations for both spectators and event managers in recognizing and preparing for these microclimates in stadiums. One of the take-home points was not to rely on just the weather forecast, but also in-stadium monitoring and targeted cooling, airflow, and hydration efforts. Dr. Jenny Van Oss explained the evidence-based interventions and unique considerations needed to keep both runners and marathon spectators safe from heat, particularly for longer endurance events. And she showed some unexpected implications of reflective pavement that I thought were fascinating. And lastly, I'm convinced that no one has ever made hydration as interesting as as Kara Castile did. She highlighted many practical tenets of effective hydration as a critical event operational requirement. She said, as many in the session conveyed, that great events don't just entertain, they take care of people. And finally, in session 3, we focused on outdoor recreation. Jennifer Proctor demonstrated how exposures that are unique to park locations and terrain and to activities like hiking and camping can impact national park visitors' heat-related risks, and that the National Park Service has some great digital and planning tools. Dr. Christy Eason then talked about factors that put football players at risk for heat illness and death. And while earlier we had learned about heat acclimatization in the workplace, Dr. Eason discussed the role of acclimatization and changing cultural norms as part of a comprehensive heat mitigation strategy for these athletes. Andrew Grunstein built upon this theme and highlighted that equipment and uniforms also matter, based on some striking data on heat illness among marching bands. Dr. Jim Taylor discussed the complex impacts of heat on the physical and psychological performance of athletes and potential adaptation and coping mechanisms. And closing out day 1, Dr. Bud Cooper detailed a success story from Georgia, where progressively broader implementation of data-driven policies dropped exertional heat illness cases by 74% and clearly saved lives. Next slide. My overall takeaways from day 1 are here. Aside from the immense respect that I have for the amazing work that these experts are doing every day and many more like them, and the very actionable recommendations they had for us yesterday. So some additional takeaways are that effective heat strategies don't need to be complicated or expensive, and that strong data and communication are needed to improve heat policies and safety in our communities. So with that recap, I'll give the floor to my NIHIS co-chair, Kim McMahon, to talk about NIHIS and the exciting agenda we have today.
Thanks, Arthi. Good morning and good afternoon from wherever you may be joining us. I'm Kim McMahon with the NOAA National Weather Service and a co-chair of NIHIS, like Arthi mentioned. Just over a decade ago, NIHIS was co-founded by the CDC and NOAA to collaborate on extreme heat, a silent killer that is both an environmental and public health hazard. Launched in 2015, NIHIS has grown to include over 24 federal agencies, including FEMA, the EPA, OSHA, and the National Park Service, just to name a few. We work across our varying disciplines to reduce heat-related illness and death, including the co-development of some heat health-related tools, which you'll hear about later today. Since our launch, NIHIS has connected with communities to conduct over 80 urban heat island mapping campaigns to build understanding of the hottest areas within those communities and cities. We have held pilot programs and heat tabletop exercises with state, local, tribal, and territorial partners in cities like Miami, Phoenix, and Charleston, South Carolina, in order to build the understanding of local heat impacts and improve interventions for affected populations. We also launched heat.gov to serve as the one-stop shop for information and resources regarding heat and heat health. And I'd be remiss if I didn't mention our annual Heat Safety Week social media campaigns, now entering its 5th year. With the NIHIS mission to build societal understanding of heat risks, develop science-based solutions, and improve capacity, communication, and decision-making to reduce heat-related illness and death, our work is built entirely on partnerships with state, local, tribal, and territorial communities. This includes academia, nonprofit, and public and private sectors, all of us working together to reduce heat-related illness and death. Next slide. In today's agenda, We're moving from defining the what and why of day one to the how of safety and solutions. Our first session will focus on heat safety strategies. We begin with Dr. John Jardine, who will provide a frontline look at medical care and life-saving interventions for heat stroke at road races. Then my colleague Jessica Lee will walk us through critical resources, specifically how to utilize heat risk and the wet bulb globe temperature to make data-driven safety decisions. We then shift to the policy level with Shelby Davis, who will present a review of evidence-based health interventions to provide a roadmap for state and territorial agencies. We'll conclude our first session with Stephen Edelman, who will explore the significant legal risks and liabilities associated with heat at public events. This afternoon features an interactive heat tabletop exercise, and this engagement will allow you to work through a real-world simulation of an extreme heat event, testing your response protocols and communication strategies in a safe, collaborative environment. We will move into our final session, heat response case studies, and this session is all about practical application. Spencer Adkins will share how to protect performers in the marching arts, followed by Stacy Embritson, who will provide lessons learned from the ASICS Los Angeles Marathon. And we'll look at collegiate athletics with Chad Schaefer, who will discuss heat safety at the University of Missouri football games. And then we'll look forward towards the future with Edith de Guzman as she presents Shade LA, an initiative to cool Los Angeles before the 2028 Summer Olympics. We'll end our presentations with our closing keynote speaker, Dr. Ali J, examining a case study of heat at the 2026 Australia Open. Our goal for day two is to take ideas and lessons from these sessions and turn them into actionable strategies and plans for this and future heat seasons. So let's get started. To kick off our first session today, we have Amanda Reinhart from National Weather Prediction Center, Program Coordinator with the NOAA National Weather Service. She'll be acting as our moderator. And Amanda oversees the routine forecasts and non-precipitation hazards for the National Weather Service, including extreme heat. So Amanda, take it away.
Thanks, Kim, and good afternoon, good morning, everyone. So let's kick off the first session. The session, Heat Safety Strategies, will feature different heat safety strategies for outdoor events. The four presenters will speak on heat resources, tools, checklists, and case studies at various levels, from national to local communities. Our first speaker, Dr. John Jardine, is a board-certified emergency medicine physician. He is the medical director for the Falmouth Road Race. In his 25 years as medical director, Dr. Jardine has treated more than 500 cases of exertional heat stroke. He also serves as the chief medical officer for the Corey Stringer Institute at the University of Connecticut, and on the expert and advisory panel of the World Academy for Endurance Medicine for World Athletics. Dr. Jardine, take it away.
Yeah, thanks very much, Amanda, and thanks everybody for inviting me. I am going to talk about medical care and heat illness at the Falmouth Road Race. Next slide, please. So this is Falmouth, Massachusetts. This is mile one of the race, and it's a rather iconic race. The Sports Illustrated named it one of the 10 most iconic races in the country. So it's a pretty popular race, and I'll talk about what we do there. Next, please. So this is Falmouth, Massachusetts. Those of you not familiar with Falmouth, Falmouth is a town on the lower part of Cape Cod, which juts off of Massachusetts. It's important to know that, although it looks like a peninsula, it's actually a man-made island. Cape Cod is a man-made island because there's a canal that is cut through to separate it from the mainland. And that's important because it's, we're accessible by two bridges, and that, could mean a lot to us when we're transporting patients or, trying to get supplies in and off the Cape. So again, we are geographically isolated. And the other thing is, because it's a peninsula sticking out into the ocean, we have some pretty unique weather patterns, and we'll talk about that as we go along. So next, please. So again, Falmouth, Massachusetts year-round population is somewhere around 33,000, but you can imagine this is a summer community and the population swells in the summer, right? So population more than triples, it exceeds 100,000 people. And certainly on race day, it's even more than that. Again, next, please. Yep. So this is about the Falmouth Road Race. So the Falmouth Road Race was established back in 1973. 1972, Frank Shorter had won the gold medal in the men's marathon in the Olympics. So it really stimulated an interest in running. This was a race that was from one bar to another bar, and that's why the 7 mile distance. It's a unique distance because it started from one bar to another bar, and it was actually the first race was a fundraising event for the girls track team at the high school. It is now held on the third Sunday in August, so we have a particularly hot day or a hot month. We now have a 9 a.m. start time. The original race, I think, started at noontime, and then we back down to 10 o'clock. About 15 years ago, we moved it to 9 o'clock, and we'll talk about that just in a minute. We register more than 12,000 runners. They register somewhere around 13,000 runners. And of course, the spectators are in the hundreds of thousands of people, watching the race. And the medical care there is provided by volunteers, which I'll talk about. Next, please. So this is what we've seen over the years, over my 25 years in the road race. We've seen about 513 cases of exertional heat stroke. You can see some years are more busy than others. Last year, we saw 39 cases of heat stroke. In 2003, we set a record with 53, and I'll bring up 2003 again as we move on. You can go next, please. So again, what I said is we have a medical team that's comprised mostly of volunteers. So we have medical volunteers, we have non-medical volunteers who help with the actual care, but this is a multidisciplinary approach, right? So we work with local EMS. We have a great relationship with our local EMS providers. We have a relationship with the local hospital and the local police, as well as DPW and other services that we need to make the race safe. I'm going to talk about how we interact with these folks as we progress. So next, please. So the hospital, there is a hospital in Falmouth. It's a small hospital. It's an 81-bed hospital that has 4 floors. And there is a 33-bed, relatively new emergency department, the Yawkey Emergency Center. And they treat about 40,000 people annually. Again, you can imagine during the summertime when the population is tripled and or on race day, that they typically will see a lot more patients. Cape Cod Hospital is another hospital on the Cape that's in Hyannis, which is further down Cape. And that, together with Falmouth, constitutes what we call Cape Cod Healthcare. So there is a partnership there. Next, please. So where do we put our medical tents? So this is a map of Falmouth. You can see that the purple line is the race route. And then again, it's a 7-mile point-to-point race. Starts in Woods Hole and moves on to the finish line. The pink bubbles are the mile markers. And where we put our tents is where you see the red stars. So we have a tent at the start of the race. And in our first tent along the course at mile 4 there at Mill Road. And then the runners run around the Falmouth Harbor. So we have a tent on each side of the harbor. And then of course a tent at the finish line. So next, please. This is the start of the race. You can see that there are, 13,000, close to 13,000 people there ready to run out of Woods Hole. And you can see that it's a pretty confined space and it's pretty tightly packed. So we have decided to put medical care there in case, there's a medical emergency there, because it would be very difficult to get an ambulance in or, EMS crews into that crowd. So we start our race with a medical tent at the start. You can move on, please. And then we have many protocols that are in place on race day, 2 of which I've listed here. We use cold water immersion for the care of exertional heat stroke because there was an article published almost 20 years ago now that showed that cold water immersion is the gold standard for the treatment of exertional heat stroke. So we use cold water immersion, and you can see an example of a cold water immersion tub there in the picture. And then we also use a principle that we call cool first, transport second. So if we do have to transport somebody to the hospital, we cool them first before we transport to the hospital. And this is a concept that we're trying to promulgate in EMS as well, and I'll talk about that coming up. The other things that we do on race day is because we have 5 on-course tents, is that we divert all of the 911 calls through our communications center on that day, so that anybody picked up on the race course goes to one of our tents as opposed to going to the ER. We know that there's a predominance of heat illness and heat injury on that day, so we think that we can, certainly serve these people quicker and better probably in the tents than in the ER on race day. You can go next, please. So this is a picture of the finish line medical tent. You can see that there are lots of tubs set up there. And again, we base how many tubs we're going to need on the weather conditions, right? So we know that if it's going to be particularly hot day, we'll set up for more tubs, and cooler days probably require less tubs. So we are certainly cognizant of the weather and climate as we prepare for the race. You can go next. Oh, sorry. Yep. So the warm weather events require ice, right? So we know that we need lots of ice. I referred to 2003 when we set a record with 53 heat strokes that day. We actually ran out of ice because they had given us a fixed quantity of ice, and we actually ran out. So now what we do is we keep a refrigerated truck in the parking lot, and we have as much ice as we'll ever need. And the ice that we don't use goes back to the company, but we always have a supply of ice. So again, if you're having a warm weather event or planning a warm weather event, obviously you're going to need access to ice. Next, please. So I mentioned the weather, and we certainly keep an eye on the weather. The week leading up to the race, we monitor weather conditions. We look for trends. We look for, if there are going to be issues with high temperatures or God forbid, thunderstorms or something like that. But we're monitoring the weather every day and right up until race day. You can click next. So each of the days leading up to the race, we have a weather meeting, and we get together with the staff of the race and the organizers of the race, and we meet and we discuss, again, weather conditions on that day and what we see as trends in the upcoming days, planning ahead for what we see ahead. We use WBGT monitoring, wet bulb globe temperature monitoring. We use that at the start of the race, along the race, and then, of course, at the finish line. And WBGT temperatures are what we base certainly our predictions or our climate control plan on. So you can go next, please. So this is a study that we did a few years ago, and we showed that, not surprisingly, as WBGT temperatures rose, so did our incidence of exertional heat stroke, right? So you can see on the left, exertional heat stroke incidence per 1,000 finishers. And again, as WBGT rises, so does that incidence. So you can see in the black, that one diamond that shows in the black zone, that's 2003 that I keep referring to. So that was a race that we were not using WBGT at that time, but probably, if we were, we may have considered canceling that race. It was a dangerously hot day. We also know that from this study that every 2 degrees Celsius that the WBGT raises, that means that there's going to be one more incident per 1,000 finishers. So we know that we typically have about two cases per 1,000 finishers. But again, as the temperature goes up every 2 degrees, we add one. So we can kind of predict where we're going to be with the number of cases of exertional heat stroke. You can go next, please. So not surprisingly, temperatures are warming up, right? We all know this, and that's why we're here. 2003 was the hottest temperatures on record. 2004 beat that record. You can click next. So our EMS partners, the people who are taking care of these, us in the heat, the number of people suffering heat stroke reaches record levels again in 2004. And EMS crews, how can they beat the heat in a changing world? So again, EMS is paying attention to this, and as we are. And again, we have a great relationship with EMS at the race to know when these things are happening. Next, please. So this is, again, not surprising to the folks probably on this conference, is that June 17th last year was the first time ever that Alaska had a heat advisory, right? So for people who say, well, it's not going to happen in my part of the country, it's not going to happen in, it's always cool here. Even Alaska has had a heat advisory. You mentioned that I'm the chief medical officer for the Corey Stringer Institute. Corey Stringer, a Minnesota Viking, died from heat stroke in Minnesota. So again, it's happening everywhere, and it's something that we all have to pay attention to. Next, please. And what we've noticed, unfortunately, as heat is increasing, so are heat-related deaths, right? So this is a trend of heat-related deaths in the United States. You could see, again, intuitively, as temperature goes up, so do the amount of heat deaths. So something we have to pay attention to. Go next, please. So we took a look at Falmouth, and we, in the interest of safety, we said, okay, what's projected for Falmouth? Where are we going with temperatures? And again, not surprisingly, everything is rising. Temperatures are rising, and I, try to look over the time that I have been there, in the 25 years that I have been there. I think the temperature has risen, 4 or 5 degrees. So it's happening in our lifetime, and it's happening quickly. So next, please. So what we did is for the past 3 years, we have been talking to the administration at the Falmouth Road Race and made them aware of what's happening, right? So we have always recorded WBGT temperatures, again, at the start, along the race, and then at the finish, and we've kept track of these numbers, certainly. And then we presented them to the board of directors of the race and said, look, we noticed that there's a rise in temperature even from 8 a.m. to 9 a.m. And this is an example from last year. You see at the finish line between 8 a.m. and 9 a.m. that WBGT rose almost 10 degrees, right? So we're talking about a major rise in temperature in just 1 hour. So we suggested that if we started the race at 8 o'clock instead of 9 o'clock, we would certainly be safer temperature-wise. So you can click next. So this year, 2026, August 16th is the race. You can click the next, please. So August 16th, oh, sorry. If you can go back. Yeah, thank you. August 16th is the race this year in 2026. And for the first time in history, it's going to start at 8 a.m. Again, we feel that an earlier start time, the temperatures are going to be safer. We're going to be safer for our runners, safer for our participants, safer for spectators, safer for staff, safer for everybody, right? So we think that an hour earlier start time may make a huge difference in what we're seeing. So next, please. So we have had tremendous successes, obviously, in Falmouth because we, upscale our services when we know that it's going to be hot. We've published a couple of articles on this. And again, we've had more than 500 cases of exertional heat stroke. And the point is, though, that it's 100% survivable, right? So we show that if we intervene in somebody's care, within 30 minutes, that it is 100% survivable with cold water immersion. So next, please. So we've learned a lot of lessons in Falmouth. We've learned a lot of lessons from athletics. And so now how does that translate to other active populations? And that's a concern for EMS and people who are active in the heat. So next, please. So regarding EMS, again, I said we have a strong relationship with EMS, certainly at the race, but we looked at EMS and we said, okay, how many people are doing some of the things that we do at Falmouth, right? So certainly we use rectal thermometry for the measurement of core temperature. And you can see that graph at the top that really not a lot of EMS agencies are using rectal thermometry. And then down below, you look at who's using cold water immersion, again, as the gold standard. And you can see, again, not a lot of EMS agencies are using cold water immersion. So really not a lot of agencies using what we would consider to be best practice. Next, please. We did a study with laborers, and I know Dr. Morrissey talked yesterday and probably talked about this, that certainly the majority of non-accidental deaths in laborers was heat related, right? You can see the graph there. Certainly most of the deaths in non-accidental deaths, that is, in laborers was heat related. So in that same study, we looked at the 50 states plus the District of Columbia and Puerto Rico. So out of the 52 areas, 30 of our states have what we call statewide EMS guidelines. If you look at those statewide guidelines, though, only 9 of them recommended cold water immersion as best practice, and only 8 of them recommended the cool first transport second principle that I mentioned, cooling first before transporting to emergency care. So if you look at the United States, who are covered by these statewide protocols, only about 25% of our population is covered by what we would consider best practice. Next, please. So what I've done is, taken the Falmouth Road Race and using the word race as a mnemonic for a protocol for heat stroke. So the race protocol for heat stroke. And really what it stands for is recognition. So recognizing heat stroke, again, recognizing where and when it can happen, recognizing the signs and symptoms. It's an elevated core body temperature and an altered mental status. And then assessment, assessing the patient, including rectal thermometry. And then cooling, again, by cold water immersion as the gold standard for cooling. And then emergency care, meaning that you transport patients to emergency care, but only after cooling on site, or the cool first, transport second principle. Next, please. So this is the medical volunteers at the race. And on behalf of my volunteers, my volunteer team, my medical team, the Falmouth Road Race, I thank you again for your time. Thanks for your consideration to this. Below there, you can see my email. If you have any thoughts, concerns, questions that come up after, feel free to email me at medicaldirector@falmouthroadrace.com, and I'd be happy to answer any of your questions.
Thank you so much, Dr. Jardine. We have one question for you. Michelle asked, could you share what the cleaning process looks like with the water immersion tubs if they are used by multiple people? Is there a concern if multiple people use the same immersion container?
So we have about 30 tubs set up, and again, sometimes we have to reuse tubs. If tubs get contaminated with body fluids, of any kind, we then put them out of service. We'll just kind of put tape over them so that we don't use them. We don't dump them at the time because it would make a big mess in the tent. So, but we do occasionally have to reuse tubs, and we reuse the water and ice, again, as long as they're not contaminated with other body fluids.
Great. We have another question. How can we implement these practices across the country?
Meaning at other races or with EMS, or I'm not sure how
At other races.
at other races. Yeah, one of the concerns is that there really isn't a sort of governing body over races to suggest that you have to do this or that you have to have a medical team. My approach is that we need to really educate the runners or the people that participate in these events to start asking questions about, what is the plan? What is the emergency action plan? What does the plan involve if I do get injured or I do, suffer a heat illness? But I think that this, again, there are multiple, studies and things out there that say that cold water immersion is best, and how to set up, again, how to set up a medical team, where to put your tents and things like that. So I think there's lots of help if people look for it. Again, at KSI, at ksi.uconn.edu, we have lots of information on the website about, how to do this and where to do this and things like that. So, and again, reach out to me by email. I'd be happy to help.
And you said, you do outreach with runners. Do you guys have specific protocol for this race on how you do that?
Well, we have created videos for the runners, and one of the videos actually last year that we did, sort of related but kind of unrelated to heat illness, is we did a CPR video. So we actually, taught hands-only CPR to the runners and involved them in the care of, their fellow runners, right? So you have, 12,000 people running down the road. If they see somebody collapse or they see somebody having trouble, then they can intervene. And I think that's one of the best things to do, is sort of involve the runners in the care as well.
All right. I think that's all the questions we have for now. And if anyone thinks of anything, feel free to share it in the, oh, we have one more that
Okay.
just came in.
Okay.
How do you operationalize cold water immersion with EMS in an ambulance?
Well, yeah, it's very difficult to do in an ambulance, and that's why we sort of are talking about this cool first, transport second principle, right? So cool first before you transport. So things like, I know it's difficult probably to carry around a 50-gallon tub, but there are methods like the TARP method, the TARP assisted method, or the TACO method, where you use a waterproof tarp as your container, and or what we call an impervious shroud assisted cooling, which is also known as a body bag. We try not to use obviously that term, but there are these disposable containers like tarps and vinyl bags and things like that, yeah, that you can use for cooling um, in the pre-hospital setting. I know that I don't know if anybody is on from Arizona, but I know that the Arizona Fire Department is doing it with EMS. They're using, they have ice machines in the fire stations, and they're using these, sort of vinyl bags for cooling, and it works great. And again, the premise is to cool before you put the person into the ambulance, right? So cooling them first before you transport.
Great. Okay. I think that's all the questions. Thank you so much, Dr.
Okay, thank you
Jardine.
very much. Thank you.
All right, next we have my colleague, Jessica Lee, who is the Public Weather Program Coordinator with NOAA's National Weather Service. She guides national initiatives involving extreme temperatures, both heat and cold, wind, frost, freeze, fog, dust, and other weather phenomena. She led the rollout of the NWS Experimental Heat Risk Tool, and more recently, our new probabilistic heat risk prototype, which empowers decision makers and individuals to understand when heat health impacts are likely to occur. Jess, whenever you're ready.
All right, thank you, Amanda. Yeah, as Amanda said, I am Jess Lee, here today to give you an overview of some of the National Weather Service's forecasting heat tools. When planning for heat, most of us naturally look at air temperature and humidity. However, the National Weather Service offers additional tools to help you dive deeper. So today we'll be focusing on heat index, wet bulb globe temperature, and the experimental heat risk. Each of these tools integrates different weather parameters to provide a more complete picture than air temperature alone. And because each tool calculates heat stress differently, they have their own strengths, limitations, and target audiences. Next slide. Starting with heat index, this is the metric that most people are familiar with, and it's often called apparent temperature or similar to like a real field temperature. Heat index provides a measure of how hot it feels to the human body when relative humidity and is factored in with the actual air temperature. Heat index is calculated for shady areas with light winds and includes 21 other parameters and assumptions in its calculation. For example, that it's a 5'7" adult that weighs 147.7 pounds and is walking outside in the shade at 3.1 miles per hour with pants and a short sleeve shirt on. Heat index is often used, oh, sorry, next slide. Heat index is often used in public messaging as it is familiar to most and generally easy to understand. It's important to note that heat index is not the best indicator of heat stress in areas with low humidity, and it is not an accurate measure of heat impacts on active individuals. Additionally, because heat index values are devised for shady conditions, if you are standing in full sunshine, that can increase your heat index by up to 15 degrees. Next slide. Next up is the wet bulb globe temperature, or WBGT. Wet bulb globe temperature was developed in the 1950s by the US military to address the high numbers of heat illnesses occurring at their training camps. Wet bulb globe temperature measures heat stress on the body and takes not only temperature and dew point into account, but also solar radiation, wind speed, and cloud cover. The National Weather Service's wet bulb globe temperature forecasts are divided into 5 threat levels, which represent an increasing risk for heat-related illness, as shown in the table on the bottom right. And the threat level thresholds also vary by geography based on the wet bulb globe temperature climatologies from the Grunstein et al. Paper in 2015 titled Regional Heat Safety Thresholds for Athletics in the Contiguous United States. You can see the 3 geographical regions on the map on the top right, and they correspond with the region 1, 2, and 3 columns on the table. And on the map, the darker colors represent areas with higher wet bulb globe temperature climatologies and therefore higher threshold values. Next slide. Wet bulb globe temperature is designed for acclimatized, healthy, and physically active outdoor communities, such as the military, outdoor workers, athletes and marching bands, and those doing strenuous outdoor activities. It is useful for informing activity modifications and is intended to help guide decision makers and enhance their heat responses. Important considerations include the fact that wet bulb globe temperature is highly sensitive to surface conditions. For example, if you're on grass versus turf versus asphalt. And it's also important if you're going to use wet bulb globe temperature to have guidelines for activity modification that are specific to your activity and your area, and also that you understand how to properly interpret the values of wet bulb globe temperature. Wet bulb globe temperature values are not directly comparable to temperature or heat index, and the values are often lower than both of these, which can cause the wet bulb globe temperature values to be improperly perceived as showing a lower risk. Next slide. Okay, finally, we have the experimental heat risk. Heat risk is a collaboration between the National Weather Service and the CDC. It uses the National Weather Service temperature forecast and CDC heat health-based thresholds to identify days that may pose an increased risk for heat-related impacts to occur. And it is currently only available across the contiguous United States or the lower 48. We have plans to, in the next few weeks, roll out a point-based version for Alaska, and we are continuing to work with CDC on how we might expand to other locations outside of the lower 48. Heat risk is divided into 5 simple color number categories for each 24-hour period in the 7-day forecast, and it provides our users with a spectrum of potential impacts. So you can think of analogies such as the air quality index or the UV index, which express complicated information in easy to understand color number scales. And heat risk helps individuals understand and personalize what forecasted heat means to them and what actions they may need to take. And it also gives our users the flexibility to act when they need to, and is especially useful for individuals who are sensitive to heat and for those who may need to make decisions below our traditional heat advisory and extreme heat warning criteria. Next slide. It's important to mention some of the basic tenets that form the backbone of our heat risk approach. So first is that research has shown communities adapt and build to their local climatology, and that it is possible for people to acclimate on a timescale of a week or two to a point. Research has also shown that some level of heat can be physically dangerous to the human body, no matter the time of year, but that everyone has different heat tolerances, so there is no single threshold that will work for everybody. Next slide. Here you can see all of the factors that are considered in the heat risk approach. The big differences from traditional approaches are that in heat risk, both the high and low temperatures play a role in predicting the 24-hour value. The category thresholds identifying the various levels of heat stress change throughout the year based on local climatology, which allows heat risk to better account for acclimation. The entire 7-day period is examined to identify windows where excessive temperatures are prolonged and if there's any overnight relief. The daily forecasted difference between maximum and minimum temperature is used to estimate humidity levels. And as I already mentioned, the heat risk has the CDC heat health thresholds, which are used to inform what temperatures are dangerous to humans. Next slide. The 5 heat risk categories were devised to capture the progressive nature of heat-related health impacts. So we'll start at the upper end of the scale. So the highest or worst is the extreme category, which is colored magenta and numbered level 4. This accounts for rare and or long duration heat events that will have widespread impacts on our communities. Overnight lows will remain excessively high during these events, in addition to excessively high daytime temperatures resulting in no overnight relief. The next level is the major category, colored red and numbered level 3. These will also be highly impactful events, but the duration or intensity will be just a bit less than a magenta event. And both the magenta and red level events represent roughly the top 5% of hottest days and nights in the historical reference period for a location. Moving down the scale, the moderate category is colored orange and numbered level 2. For most people, this will be uncomfortable heat, with heat-sensitive populations likely experiencing the majority of impacts. But it is important to keep in mind that at the moderate level, there are still heat-related impacts to be expected, especially during the heat of the day. And here I just want to note that the category of heat risk that is impactful to an individual will not always be the same. So for example, at a large outdoor event, impacts can be more noticeable at the moderate category as people spend long amounts of time outdoors and they may not have as much access to water or shade or may not be taking proper precautions to stay safe. And we see this especially during the spring and fall seasons when people are also less likely to be acclimated to the heat. So the moderate category can still be useful for decision makers to begin triggering heat action plans. The minor category is colored yellow and numbered level 1. This is the lowest level of heat risk and is likely to impact only the most exposed and heat-sensitive individuals, such as children and adults over 65 years or people with pre-existing medical conditions. And then finally, our green or base level 0 represents little to no impacts. Next slide. This is a high-level overview of how heat risk is calculated. We use NOAA's climatological data and combine it with CDC heat health data to create maximum temperature and minimum temperature thresholds at roughly 3,100 stations. We then use PRISM-based climate grids to interpolate these station-based data across the contiguous US and create daily gridded maximum and minimum temperature thresholds at a 2.5 kilometer grid resolution. And once we have our various categorical thresholds, we can then compare our National Weather Service forecasted maximum and minimum temperatures to these thresholds. And our forecast maximum and temp are assigned values, which are then weighted based on the amount of humidity present to create the final 24-hour value of heat risk. And I'll also quickly note that to trigger the magenta category, these are situations where we have prolonged or consecutive days of intense heat, where both the maximum and minimum temperatures are above the 95th percentile for that location, or if we're approaching all-time record high temperatures that are at dangerous levels, this will trigger the magenta category. Next slide. So these are two examples of the station-based maximum temperature thresholds that were created. On the left, we have New York City, and on the right, we have Las Vegas. You can see that both locations have different base thresholds and daily values that are specific to their location's climatology and heat health data. For example, the max temperature yellow base threshold for New York City starts at 67 degrees, whereas for the warmer climate in Las Vegas, their yellow threshold for max temperature starts at 80 degrees. And similarly for the red base threshold, that starts at 88 degrees for New York City. And again, in the warmer climate, that starts at 105 degrees for Las Vegas. Next slide. To access heat risk, the National Weather Service has a viewer on the Weather Prediction Center webpage. This interactive website allows you to look at the heat risk data. You can move through the 7-day forecast and either enter your location into the search box or click anywhere on the map. And this will pull up the next 7 days forecast of maximum and minimum temperature, as well as heat risk for that location. And again, this is on the 2.5 kilometer grid. And then along the top, we have tabs where people can access more information. And if you go to the next slide, this also includes examples of appropriate actions that are recommended for each heat risk category. Next slide. The CDC also has a heat risk dashboard that's pulling in our forecast data and aggregates it to the county level. So first I'll point out they have guidance for healthcare professionals on the left side of their page, which has a lot of great information that I've kind of listed on the screen. And then similar to the Weather Service page, you can enter a zip code. And if you go to the next slide, this will pull up the local heat risk forecast, as well as specific actions you can take to protect yourself. And on their page, the CDC is able to provide some more specific health-related information. Next slide. Across the country, some of our local weather forecast offices have done validation studies comparing heat risk data to local heat health information. So here's an example from our Phoenix, Arizona office. They've obtained daily data of heat-related emergency department visits for Maricopa County for 2025. And Maricopa County is where the majority of the Phoenix metro area resides. And we are comparing on this chart the normalized daily emergency department visits to the observed heat risk category. So the height of each of the bars would be the normalized emergency department visits, and then the color of the bars would be the heat risk category for that day. And then the stars denote days that had extreme heat warnings in effect. The impact data reveal a telling story where we can see an obvious connection between heat injuries and the heat risk category. And then if we average out the emergency department visits by heat risk category, as shown on the bottom right, there is a linear increase between the categories. And this is just one example of impact-based research that can be done. Next slide. States and local health departments are also conducting their own evaluations. So moving to the other side of the country, this is from New York State. Again, they looked at the actual emergency department visits for heat-related illness from May to September in 2024 across 57 counties in the state. The key findings from their report were that in New York, higher heat risk levels were consistently associated with higher heat-related illness rates. And we'll go ahead and move to the next slide. Next, I want to highlight some of the ways we have seen our partners utilizing heat risk. We've seen media partners use heat risk in broadcast and on social media. Partners such as the American Red Cross and local emergency managers use heat risk in their planning documents and as part of their decision-making for opening cooling centers. Public health partners are including it in their briefings and distribution lists. And schools are using it to inform decisions on outdoor activities such as recess and after-school sports. Next slide, and then you can just go to the next slide. So finally, I want to talk about our probabilistic heat risk prototype, which is our newest tool rolled out a few weeks ago. Probabilistic heat risk is different from our existing deterministic heat risk, and that it provides a better look at the range of possibilities in the forecast and adds additional context to our deterministic single value heat risk forecast. Probabilistic heat risk allows our users to have an increased understanding of upcoming heat events and aids in the decision-making processes when planning for potential heat impacts in the coming days. Next slide. The probabilistic heat risk forecast is created by using the National Weather Service's National Blend of Models. We calculate 100 different iterations of heat risk and then compute categorical statistics for each day to create the probabilistic heat risk. I will note that probabilistic heat risk forecasts are available out to 10 days due to our model data availability versus our official forecast of heat risk. The deterministic version only goes out to 7 days. Next slide. The probabilistic heat risk prototype shows the chances of being at or above each heat risk category. So in the example on the slide here, this is back mid-April, the orange shading on the map indicates the probability of the specific day's heat risk forecast being at least moderate, with the highest likelihood in this example being centered along the southeast and the mid-Atlantic coast. So users can toggle between the different categories by using the risk level buttons on the left side of the screen. And then if you click on the map, this will pull up specific forecast information for that location. So you can click a couple times to the next slide. Okay. So this is a close-up of the pop-up charts. If you click on the map, there's two different charts that you can toggle between. So the chart on the left is the categorical distribution, and it shows the chance or frequency of the daily heat risk falling into each category. You can hover over the bar chart to see the exact values. I forgot that for this example. And then the chart on the right is the categorical probability of exceedance and shows the chance or frequency of the daily heat risk being at or above each category. So just two different ways for people to view the data, and we're collecting feedback this year to see what is most helpful. And then the bottom table shows the official National Weather Service forecast for that location, showing the forecasted maximum temperature, minimum temperature, and the 24-hour deterministic heat risk value. Next slide. So here's an example scenario of how someone may use probabilistic heat risk in their decision making. So let's say we have an emergency manager planning for a very large outdoor event, closely monitoring the forecast. The latest forecast indicates minor conditions are expected. However, probabilistic heat risk shows the potential for moderate conditions is 40%. And based on our sensitivity to heat, this emergency manager will decide to go ahead and invoke their heat plan due to that extra information. Next slide. I will just highlight the Weather Service offers a variety of heat safety information and messaging resources. So I encourage you to visit weather.gov/heat and weather.gov/safety for more information. Next slide. I will end by plugging our upcoming NWS CDC Partners and Users Heat webinar. This will take place on May 18th at 2 p.m. Eastern Time, 11 a.m. Pacific Time. It will cover some of the topics we covered today, going more in depth into them. We'll also have our CDC partner join us for the presentation, as well as some others, so feel free to scan the QR code to register. Next slide, and with that, I will take any questions.
All right. Thanks, Jess. One question we got is, if you were to be planning an event, is there a specific tool that you should use, like wet bulb glow temperature versus heat index versus heat risk?
Yeah, I think a lot of it depends on the type of event and your target audience. So again, like for athletes and people who are being active outdoors, wet bulb globe temperature is a great tool to use for that. And our forecasts provide hourly, in the short range, hourly wet bulb globe temperature forecasts. And then heat risk is a great planning tool. It does just provide the 24-hour snapshot. So it helps you highlight which days in the upcoming 7-day forecast will have the greatest potential for heat-related impacts to occur. And then for day of, you might want to use something like heat index or wet bulb globe temperature to monitor conditions on site. Hopefully that answered the question.
And then one more question before we move on to the next speaker. Is there a relationship between heat risk and wet bulb glow temperature? And would using both potentially create a conflict similar to heat index and wet bulb glow temperature?
I mean, wet bulb globe temperature is not used in the calculation of heat risk. So again, heat risk is just using the maximum and minimum temperatures along with the CDC heat health data. Whereas the wet bulb globe temperature does not have health data directly baked into it, and it's using other parameters besides temperature, like humidity and sky cover and wind. That said, we, as forecasters, we like to use all the tools in our toolbox. So I think, you can definitely use both of them for an event. And maybe there are times you may think they're conflicting, but instead of conflicting, I think it's important to consider what each tool is showing you and the data that is going into it and the intended audience. And I think that can provide some more nuance. So maybe heat risk is showing a major day when wet bulb globe temperature isn't necessarily lighting up. But that could be because, heat risk is taking into account that heat health data and is for more of a general population view, whereas wet bulb globe temperature is specifically targeting those active populations.
Great. Thanks, Jess. There are other questions in the Q&A. She will get to those during the next presentation via chat. So thanks, Jess. Our next speaker is Shelby Davis, who is a senior analyst on the environmental health team at the Association of State and Territorial Health Officials, ASTHO, where she facilitates ASTHO's climate and health and environmental public health tracking fellowship programs and ASTHO's climate change collaborative. Take it away, Shelby.
Thanks, Amanda. Hi, everyone. It's really great to be here with you all today, and here's some really amazing presentations. Today, I will be presenting an overview of climate and health interventions for extreme heat, with a focus on what current evidence tells us about effective strategies across different levels of public health practice. Next slide. So the purpose of this presentation will be to summarize evidence-based interventions that reduce heat-related illness, highlight strategies across various intervention levels, individual, community, and clinical, and then ultimately support informed decision-making for public health practice. Next slide. The findings in this presentation are from a report titled Climate and Health Interventions for Extreme Heat, a review of evidence for state and territorial health agencies. The CDC Climate and Health Program collaborated with the ASTO Environmental Health Team to write, edit, and publish this report. Next slide. So extreme heat is one of the leading causes of weather-related deaths in the United States, and its impact is increasing. Extreme heat contributes to a wide range of health outcomes, including heat exhaustion, heat stroke, and the worsening of chronic conditions such as cardiovascular and respiratory diseases. In 2003 alone, there were over 119,000 emergency department visits related to heat illness. This makes extreme heat a significant and preventable public health challenge. Next slide. Heat-related illness is influenced by both environmental and individual factors. These include high ambient temperatures, urban environments that trap heat, and physical exertion, particularly among outdoor workers. Certain populations are especially vulnerable, including older adults, infants, and individuals with chronic conditions. These groups often have a reduced ability to regulate body temperature, which increases their risk. Next slide. Interventions that address heat-related illness are generally grouped into 3 levels: individual, community, and clinical. Each level plays a distinct role from prevention to emergency response. The evidence base is ultimately still evolving, but overall the most effective approach is a multi-layered strategy that combines interventions across all 3 levels. Next slide. At the individual level, interventions focus on accessible, low-cost actions that people can take to protect themselves. These include hydration, fan use, external cooling, and internal cooling. Although much of the supporting evidence comes from controlled environments, these strategies remain essential, especially when broader systems are unavailable. Next slide. The first individual level intervention is hydration. Hydration is one of the most critical interventions for preventing heat-related illness. Hydration supports the body's primary cooling mechanism, which is sweating, and this helps regulate core body temperature. Dehydration is more common in older adults due to lower thirst and age-related decline in renal function. Evidence shows that increased fluid intake is associated with reduced mortality during heat waves, particularly for older adults. However, effectiveness of hydration depends on behavior and access. Older adults may have a reduced sense of thirst. Some populations may lack access to consistent drinking water. Hydration is simple in concept, but it's not always simple in practice. It does depend on individual behavior and access. Next slide. The next individual level intervention is fan use. Fans do not lower air temperature, but they do increase airflow and promote sweat evaporation. Their effectiveness depends on environmental conditions such as temperature and humidity. Evidence suggests they are helpful in humid environments and can reduce heat strain at very high temperatures when used at close range. They are low cost and energy efficient, especially compared to air conditioning. However, they still require access to electricity and may become ineffective or harmful when air temperature exceeds 95 degrees Fahrenheit, which is skin temperature. Next slide. Next is external cooling strategies. This is another individual level intervention. These strategies are personal cooling methods that involve direct application of a cooling medium to an individual's skin. This helps cool the blood near the skin, which can slow down or reduce the rise in the body's core temperature during physical activity. External cooling strategies such as water immersion, ice towels, self-dowsing, or wet clothing can reduce heat strain, lower core body temperature, and are often accessible in low resource settings. However, external cooling does require consistent water access and is climate dependent. The evidence is also largely based on young and healthy populations. Next slide. And then the last individual level intervention is internal cooling strategies. These include drinking cold fluids or ice slurry, and these can improve comfort and help reduce core body temperature, especially in hot and humid environments. Internal cooling is the most effective during rest and in hot and humid environments. However, internal cooling may reduce sweating in hot, dry environments and limit overall net cooling. Therefore, cold beverages and ice slurries are recommended only for hot and humid conditions. Next slide. Next, we have community level interventions, and these aim to reduce overall heat exposure and improve access to protective resources. Some community level interventions include infrastructure changes, public communication, emergency response planning, social support systems, and more. These are very promising strategies, but much of the available evidence is based on modeling rather than large-scale real-world evaluation. Next slide. One of the most impactful community-level interventions involves improving the built environment. So urban areas often experience higher temperatures due to the urban heat island effect, driven by materials like concrete and asphalt. Increasing tree canopy and green space can significantly reduce temperatures, while cool roofs can reflect sunlight and lower heat absorption. When combined, these interventions can reduce temperatures even further and are associated with lower heat-related mortality. However, they also require long-term planning, investment, and equitable implementation. Next slide. Next, we have cooling centers, which provide access to air-conditioned spaces during extreme heat events and can even provide, in even short periods of individuals using cooling centers can reduce health risks. However, cooling centers are often underutilized due to barriers such as transportation challenges, social stigma, and reluctance for individuals to leave their home. Cooling centers are most effective when located along public transit routes and paired with existing social services. Next slide. Another community-level intervention is heat communication. The goal of heat communication is to increase awareness and promote protective behaviors. However, we know that information alone is not enough to change behavior. Vulnerable groups may not receive communications or they may not identify themselves as at risk. Effective heat communication includes using multiple communication channels, tailoring messaging to specific populations, and pairing communication with accessible resources. Next slide. Heat response plans help coordinate activities across agencies and ensure timely action. They include early alert systems and thresholds, clear roles and responsibilities, protection for vulnerable populations, and coordination across agencies. If done effectively, they can improve timing and organization of a variety of heat interventions. However, there is limited research regarding effectiveness of individual components that comprise heat response plans. Since heat plans typically comprise of a range of interventions, often introduced simultaneously when the heat plan is implemented or updated, it's difficult to figure out whether the effect of each intervention separately had any reduced health impacts. Next slide. Real-time surveillance allows for monitoring of health and environmental data, such as emergency room visits, hospitalizations, and weather data. When health officials detect an increase in the incidence of heat-related illness for a particular period of time, it may trigger a heat warning for the affected region or population. These warnings can be directed toward populations that have a very high rate of heat-related illness, such as older adults, pregnant women, and people with chronic health conditions. Evidence shows areas that implemented heat warnings had significantly lowered mortality and increased healthcare utilization. Next slide. Social support systems such as wellness checks or community networks, buddy systems, and community outreach programs reduce social isolation and improve resilience. Social isolation has been strongly linked to increased mortality during heat events. These systems are especially important for older people living alone, as well as mobility impaired individuals. Next slide. So we talked about individual level interventions. We also talked about community level, and now I'll speak a little bit about clinical interventions. At the clinical level, the focus shifts to treatment after symptoms occur. The most critical factor is rapid cooling, particularly in cases of heat stroke. Cold water immersion is the most effective method, while evaporative cooling provides a practical alternative. The first hour after collapse, often referred to as the golden hour, is critical, as delays in treatment significantly increase mortality risk. Next slide. And I think you'll have to hit the next one more time. There we go. Oh, thank you. Heat-related illness is increasing, but is largely preventable with coordinated action. No single solution is sufficient. Effective strategies must operate across multiple levels of intervention. Recommendations based on the report I mentioned include strengthening integrated heat response planning, expanding access to cooling resources, investing in built environment improvements, enhancing targeted outreach to vulnerable populations, and improving data collection and surveillance systems. All of these actions can significantly improve resilience to extreme heat. Next slide. Again, thank you so much for having me today, and I'm happy to take any questions or discuss anything further.
Thank you, Shelby. Our first question is, I heard fan use is only beneficial in conjunction with misting. Otherwise, it is just moving around the hot air and giving a false sense of cooling while not reducing the risk of heat-related illness. Do you have a response for that?
Yeah, so the evidence for fan use is that it's helpful in humid environments. So the misting, my understanding is that the misting paired with the fanning can actually be, helpful. It's adding that bit of humidity. So that is, again, just my basic understanding of it, but I'm also happy to share the report. We haven't published it yet, but when it comes out, it does go way more in depth on each of the specific interventions. I just provided a very high level overview, but happy to share that when it comes out.
Okay, great. Are there specific considerations for unhoused and people that use substances mentioned in the report?
I I believe so. Yes, there definitely is for unhoused populations. I'm not 100% sure about substance abuse. I'll have to get back to you on that one.
Okay, next question. How would you recommend convincing skeptical elected leaders to adopt the multi-level approach?
That is $1 million question. I think the evidence is one thing that really speaks for itself. I'm really glad to see that there are more studies being published, and I hope that that evidence will help. I did mention that, there are studies on these different interventions, but clearly there need to be more studies, and there are limitations on some of the studies that I shared. So I think with an increase, we do have evidence, but with an increase of more evidence, I think that can make a stronger case to our elected officials in providing support for this work.
Okay, next question. Given the increase in energy bills we are seeing across the country, do you recommend any additional measures to address the possibility of more individuals not utilizing AC in their homes?
I'm sorry, can you repeat the question? Not sure
Oh, yeah, can you hear me?
Yes, go ahead.
Okay, just making sure it's not on my end. Okay. Given the increase in energy bills we are seeing across the country, do you recommend any additional measures to address the possibility of more individuals not utilizing AC in their homes?
Great, thank you for repeating that. So that is a significant barrier to access. So, that's why it's really important that a few different strategies to address heat-related illness are used. If we rely solely on individual, that's not going to cut it, because if electricity bills are rising, less people have access to air conditioning. So it's really important to have a series of different types of interventions, cooling centers, early warning signals, things like that. So lots of different interventions coming together rather than solely relying on air conditioning, for example, or solely relying on fan use, is a great way to tackle those rising costs in air conditioning.
All right, there's one more question in the chat. It was 1:14 p.m. Jess is still going to get to the other question, so if you could address it in the chat, Shelby, that'd be great. We can
I
move
can do
on
that.
to.
Yep.
All right, great. Thank you so much. All right, we'll now move on to our final speaker of this session. We have Steve Adelman, who is the head of Adelman Law Group, PLLC, and the founder of the Event Safety Alliance. He creates safety plans, provides crowd manager training, and serves as an event safety standard of care expert in significant lawsuits, including the cases arising from the 2011 Indiana State Fair stage roof collapse, the 2017 Route 91 Harvest Festival shooting in Las Vegas, and the 2021 Astroworld Festival crowd crush. Mr. Adelman led the task groups that created American national standards for 3 related aspects of event safeties. Steve, take it away.
Thanks very much. Hi, everyone. I'm Steve Adelman. Surely by now you've been thinking, wow, we've been talking about heat and heat-related things. Shouldn't we hear from someone who will actually make us sweat? Well, your moment is at hand, because I'm a lawyer and I'm going to tell you not about meteorological science, because I don't know much of that, but rather about the legal implications of, well, the fact that we are in a warming planet and still trying to do outdoor events. So if that's your thing, draw near, because I will first make you sweat, and then at the end of my talk, I will provide a checklist which will hopefully help you cool down if you insist on doing this risky thing. which is important to the way humans gather and relate to each other in the world. So I'm going to use a case study, which is soccer, because I'm a soccer fan. I do love soccer, and we have a major event coming in North America starting next month. And that's exciting and fraught with legal issues that I'm just jammed up to. I want to think about that stuff, so I'm sharing with you. Anyway, that's what we're doing. So the hot seat, legal risks associated with heat at events. Here we go. First, next slide, please. I have to remember to do that. This is the answer to the question that you probably haven't been asking. Why should I be listening to this guy? So you already heard my brief introduction. I'll let your eyes feast on these words until I finish this sentence, and then we can advance to the, wait for it, ellipsis. Next slide, please. There we go. Okay, let's do some law. This won't hurt a bit. There are only 4 elements. We're talking about torts. Torts are the law of civil wrongs. There are 4 elements to a tort. Here we go. Duty, breach, causation, and harm. I could do that with my eyes closed. I could do that when I wake up in the morning, and I do. We're going to focus on the first of those 4 elements. Those are the things that a plaintiff needs to prove exist on any given set of facts after something has gone wrong, someone sustains an owie, or some things break. Those are always the 4 elements of a tort. Again, we'll focus on the first one, which is duty, specifically duty of care. So let's go to the next slide, please. There we go. A venue or event operator's duty of care. I will read this. I am loath to read slides, but this is important, and I'm going to read it slowly. So everyone has a legal duty to provide reasonably safe premises. Pause. See if you can catch the theme here. I'll start again. Everyone has a legal duty to provide reasonably safe premises for reasonably foreseeable invitees engaged in reasonably foreseeable behavior. And if you're like raising your hand right now saying, ooh, Steve, I know, it's reasonable, bing, 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 you're right. Unfortunately, knowing that your behavior has to be reasonable is only the beginning of the analysis, because reasonableness doesn't exist as a thing. You know, I'm holding my watch right now. That's a thing. Reasonableness is not something that you can turn in your hands and say, I know what that is. Reasonableness exists only in context. So for the rest of this presentation, we're going to talk about context. But let me add one more important element to the duty of care, because this matters a lot for the discussion of heat. Remember heat? That's what we're talking about here. The second prong, lawyers like prongs, the second prong of the legal duty of care is there is no duty to warn. So if you are the event organizer, this should originally give you solace before we get to the end of the sentence, and at that point your heart may sink again. If you are organizing an event, there is no duty, meaning you, as the event organizer, do not have a legal duty to warn of hazards that are open and obvious. Open and obvious, he uses air quotes, because that is a legally defined term in whatever state or jurisdiction you live in. Open and obvious dangers will be defined through the run of legal decisions over the course of many years. That's the first part of that sentence. The event organizer has no duty to warn of open and obvious dangers that you cannot reasonably eliminate or mitigate. And that is where the action is for this discussion. Hazards that you cannot reasonably eliminate or mitigate, because, well, you can't eliminate heat, but you can mitigate the risk of heat to some extent to human beings who are affected by it. That's kind of where this entire 2 days has been going. So now let's apply that prong of the legal duty of care. That Happily, you do not have a legal duty to warn of open and obvious dangers that you cannot reasonably eliminate or mitigate. Let's focus on the second part. Next slide, please. So what we're going to talk about is FIFA. Yay! It's coming. It's coming to North America, Mexico, the United States, and Canada next month, middle of next month, and running through mid to late July. We call that summertime, summer in North America. At this point, you can tell maybe where this is going. So let's see if by looking at the relatively recent past, if there are any lessons that one could learn and apply to that legal duty where you don't have a duty to warn of open and obvious dangers that you cannot eliminate or mitigate. Next slide, please. So what have we learned? Well, in 2022, they decided in FIFA's infinite wisdom to host the World Cup in Qatar. Qatar is desert. I lived in Arizona for more than 2 decades. About the only place on planet Earth hotter than Scottsdale, Arizona, my former home, is this part of the Middle East. Wisely, FIFA moved the dates of the World Cup from their usual summertime to late fall, where the heat was something less than blast furnace hot. And thus, nobody died during the playing of the World Cup. I say that's a win. So, what did they learn from 2022? Next slide, please. Well, in North America, we hosted another international soccer tournament in 2024. It was the Copa America tournament. We weren't supposed to host it. Panama was, but, well, they had other issues, and so we raised our hands and offered to help. And that was nice of us. In the US, we sometimes are nice. But sometimes bad things happen to nice people. Next slide. Let's see what happened. So this was summer 2024, the Copa America tournament, which took place in the United States. So the championship game was July 14, 2024 at Hard Rock Stadium in Miami. I was in Miami 2 weeks ago. For work, not for play, and, well, it was warm then. And that wasn't July, that was later April. And there was a nice cloud cover. It wasn't bad. I didn't start sweating until, 5 minutes after I started walking. And that was April. So, the Copa America Championship game was July 14, 2024 in Miami. Next slide, please. There were various news reports in advance of that game. And, well, some of them came from the county itself, and that was nice of them to warn their foreign visitors that it could be hot, and they did. So Miami-Dade County is proud to be a host for several of the big matches, including the final at Hard Rock Stadium. And that was great. Whether you're visiting our country or you live here, here are some tips to help you navigate the events. And they were all weather related. It's hot out here. Out there, they said, but really they meant here because they're writing for Miami-Dade County. Be familiar with common signs of heat stroke and heat exhaustion. I don't know. Would it have been better if they had said what those common signs were? I think so. Rather than just saying, be familiar, do a Google search. Yeah, do your own research. There was room for improvement there. Stay hydrated. Solid advice. We've heard that earlier today and yesterday as well. Drink plenty of water. How much? Give us some more than just plenty. Plenty is contextual. What's plenty for me might be different for you. Take breaks in cool shaded areas. I like that advice. Kind of hope that there's going to be some. So TBD on that one. The weather moves fast around here. Be sure to monitor forecasts and plan accordingly. With what? I have a dear friend who has taught me that this device, this is my cell phone, this is not a meteorological prediction tool that I should rely on when it comes to health and safety, because apps are, well, they're good, they're always improving, but there is a timeliness and accuracy issue regarding weather prediction technology. So thanks, Miami-Dade County, but a little short of actionable information. Next slide, please. So what happened? Well, this happened. There were heat-induced incidents. By the way, I don't work that hard to create these slide decks. I just Google stuff. I follow the news and then I look up what happened. So this is something that you or anyone else who's organizing outdoor events could easily find. There's a hint about that coming in a few minutes when I get to the checklist. But, note, you too, dear viewer, you too could find what's the weather going to be like within a certain foreseeable range. What is the foreseeable weather going to be like at your upcoming event? That's information that you should have because you bear a legal burden to behave reasonably under the circumstances of your event for the foreseeable behavior of your foreseeable crowds. So let's look back and see what happened in 2024. How did they measure up? Again, we're using this as a case study because other people can be on the hot seat so that we don't have to be. So June 2024, there was a match in Kansas City. I've been to Kansas City in the summer. It's hot and muggy. And it was, in fact, hot and muggy because that's the foreseeable weather in Kansas City, Missouri in late June most years. So it says in this ESPN.com report, ESPN.com, for people who don't care about sports, is not known for its weather predictions. It's not a meteorological site. They care about sports, but they seem to have gotten up to speed on this. They wrote, the weather is oppressively hot and humid and hardly the ideal conditions for such a competition. Uh-oh, if the sports nerds can figure that out, maybe there's a message for the event people. Just suggesting. The high temperature in Kansas City that day was 93 degrees with humidity of 53%, so it felt like 103 degrees Fahrenheit. That's hot. That's crappy weather to be exerting yourself for 90 plus minutes, and a player and a referee, a game official, both suffered from heat exhaustion. That was Kansas City. Next slide, please. So as a preview, that was Kansas City, and Miami is hotter and more humid. So when they got to July 14 with the Copa America final, the local news in Miami suggested Argentina and Colombia fans should expect lower temperatures. Yay! Because they will no longer have to feel the heat index in the hundreds as temperatures lower into the 90s and later 80s during the game. But there is a heat advisory until 6 p.m. So that was the forecast. What did they do with that? Next slide, please. Well, it turns out that the forecast was problematic because of the crowd behavior. So remember those 3 iterations of the word reasonable where you raised your hand and said, ooh, I know. That wasn't just me being funny, although it was me being funny. That's actually the law. And so the foreseeable crowd behavior is part of your legal duty to anticipate and to mitigate any resulting risks or hazards. So in this instance, the crowd, the people who attended the Argentina-Colombia soccer match, foreseeably, if you care about international soccer, foreseeably tried to get in without tickets, because that's a thing. Is it a good thing? That's not my position, but it's a thing. It is reasonably foreseeable under the circumstances. And so there was a crowd that tried to get in without tickets. The Hard Rock Stadium security crew was told, shut the gates, don't let in ticketless fans. As a result, fans were kept outside the gates. Remember that heat index? Oh, yeah. So now fans are queued up outside in the Miami sun. They can't get in because the gates are closed. The sun is beating down on them. The humidity is soaking them. Where's the water? It's inside. Where's the shade? Not there. So now you have people who are stuck, queued up outside. What's the foreseeable result? Last paragraph, the crowd grew impatient and frustrated with the delays caused by an increased security presence amid intense heat, and some of them reported heat exhaustion. Arguably, that was reasonably foreseeable as a hazardous outcome of the foreseeable crowd behavior under those circumstances. So let's go to the next slide and turn our attention to next month. So here is the game schedule for the 2026 FIFA World Cup, which I am looking forward to very much, and I hope that you are too, because it's cool. It's a big deal. In the rest of the World Cup is the biggest sporting event in the world. You can see on this graphic that there are matches in cooler places and warmer places. Thankfully, some of the matches in warmer places are in stadiums that are covered, such as Houston, Texas. They have a dome stadium. Dallas does also. Los Angeles, not so hot, but they also have a dome stadium. That's great. Miami still doesn't. And the final in New York at MetLife Stadium, which we'll call something different in just a second. New York, New Jersey also suffers from high heat and higher humidity in the summertime. And next slide, please. In the wisdom of FIFA's scheduling, the semifinal, which they call the bronze match, sort of the consolation game between the third and fourth place teams, that is at Miami Stadium, the same place that the Copa America final was, and that's July 18. And the final will be the next day at New York, New Jersey Stadium, and that's July 19. And the most foreseeable weather in those two places at those two times of year is hot and humid, which has health consequences for lots of people. Let's go to the next slide and now apply our legal duty of care. Oh, what a good idea, Steve. Let's do that. Next slide. Here's your checklist. I said there would be a checklist. Here it is. The real takeaways from the checklist are the bold-faced numbers 1, 2, 3, and 4. It's an outline. It's an outline of what you should focus on. And quite simply, they are the underlined words. I do try to give good notes. So assess the risk of extreme heat for each venue. Miami, yeah, it's going to be hot and humid. So if you're thinking misting system, no, introducing more water, bad idea. You got to do something else to mitigate the humidity. So lots and lots and lots of free water. And by the way, remember when we talked about those 3 iterations of reasonable? The question is, heat is a risk that needs to be assessed for whom? In this case, there are different demographics and they all matter. The players, well, that's kind of the obvious one. They're going to be well taken care of. They've got clubs and leagues and agents and stuff like that. I'm worried about them, but they've got people looking after them. Fans? I'm definitely worried about them. Workers? Yeah, I'm definitely worried about them too. So if you're organizing an event, remember that you have different demographics, different stakeholders that you need to take care of who may have very different levels of caretakers or care providers looking after their health and safety. That's number 1, assess the risk. Number 2, plan for the risks that you have to mitigate and plan to mitigate them, meaning have a plan go through the resources that you have available to mitigate the risks that you have, whether those resources are physical, pallets of water, human, staffing, timing plans, move the match later, or whatever is your event, move it to a cooler time of day. These are options that you have. So under number 2, I suggested things that might be applicable for an outdoor soccer match in July in a hot, humid place. You simply want to translate this for your own events because the basic issues will be the same. The specific application will differ. The legal principles don't change. The questions asked by the law do not change. The answers provided by the event organizer or whoever is involved in an event, the specific answers related to a specific event at a specific place at a specific time of year, the answers will change. You are the expert in the answers. I'm just giving you an outline right now. So 1, assess the risk. 2, plan to mitigate the risk. 3, monitor the weather, not with your cell phone, but with real meteorological forecasting technology. I'm preaching to the choir with this group, I suspect, I hope, I pray. But please use real meteorological science that is accurate for the place that you are. And your phone is not good enough. It may be fine for you to know whether to bring a raincoat or not, but if you're hosting business invitees, that's the legal term for the guests at an event, they are relying on you. They need more accurate information located for your event space. So monitor the weather and how people react to maintain a heat policy that is reasonable under the circumstances that actually exist. If you know that your crowd is foreseeably going to be non-compliant, if, for example, you have a general admission crowd, they're not going to want to lose their place. You have to do more to move them away from danger to someplace that is cooler, out of harm's way, because they're not going to want to give up their place near whatever is the attraction. 4, after the event is done, evaluate how you did, because that's how you learn. So I've kind of done a mini version of that by looking past 4 years, first at Qatar, then at Copa America, because these are lessons that can be learned for the upcoming World Cup. And again, I really hope that there are good plans in place because I'm a fan. I want this to go well. I know what the questions are. Now I'm eager to see what the answers are. And I hope that you are too. Next slide, please. And that is my presentation. Thank you for your attention. If you have any questions, bring them on.
Thank you, Steve, for that great presentation. One question is there a legal responsibility for people getting to and from stadiums safely, especially if heat may impact transit systems or events like tailgating, let's say, outside of a stadium?
Oh, yes, there is. And that is a whole different conversation. I'll give you the vocabulary and then urge you, check back with me. So my contact information is up on the screen right now. Take a picture or, put it someplace in your notes. Check back with me in about a month. The vocabulary that you want is called Zone X, EX. Zone X means the external zone outside of a physical built structure or event site where you and other stakeholders may have some measure of joint control, but you definitely have some measure of joint responsibility. Whether you control a parking lot or not, if people are there doing whatever they're doing because you're hosting an event inside the building, the health and safety of those fans is at least partly your responsibility because the only reason they're there is your event. So the answer to the question is yes. There's a whole concept that I'd be delighted to explain to you, but it defies, 30-second summary. So check back with me because, in a month, it will, God willing, become part of the American National Standard for Crowd Management, which is known as ANSI ES 1.9-2020. And hopefully we'll be talking about ANSI ES 1.9-2020 paren R for revision 2026. And the revision will be adding Zone X.
All right, next question. How is the responsibility different for reasonably protecting spectators versus athletes? Also, are there examples of mass misting for spectators?
Let's take the first one first. The legal duty is the same towards everyone. How that duty manifests itself will be different, likely, because if we're talking about professional athletes, they have people taking care of them. But let's talk about amateurs. I used to play Sunday morning soccer. There was nobody looking after us, so we had to look after ourselves. Or in this context, whoever is the event organizer has a duty of care to look after the health and safety. Say it the right way, Steve. The event organizer has a legal duty to provide reasonably safe premises for the foreseeable invitees. So that includes athletes and fans and even workers. Remind me what the second part of the question was. Oh, misters. Misters are hard. So again, I lived in Arizona for 22 years. In the soccer stadium of Phoenix Rising, which is the next level down from Major League Soccer, there were misters, but not into the seating bowl because it's just not practical. As I understand it, again, I'm a lawyer, but God knows I lived around misters for long enough. The mist has to be close enough to you so that some amount of moisture can reach you. And if the mist starts from far away, like at the top of a stadium seating bowl, it's just not going to reach you in time. So it's not a practical solution.
All right, last question. Curious how hosts can be held responsible for their negligence in following these rules for the Miami example with fans outside of Copa America.
Well, that is our great American legal system where anybody can sue for anything. They may not win, but they can sue. So if, God forbid, somebody suffers a heat-related injury or illness at an event of yours, whoever you happen to be in this context, if they find a plaintiff's injury lawyer who deems the case valuable enough that there is a decent likelihood of success, they will file a lawsuit and they will sue for money damages. That's how enforcement of reasonable behavior works. Steve Edelman saying this is what you should do, wagging my lawyerly finger, which I hate doing. Me saying what you should do is not self-enforcing. Rather, the enforcement of reasonable practices happens only when people exercise their right to sue when they think something unreasonable has been done. It is much better. My recommendation to you, gentle viewer, is follow these recommendations because it's not fun to be sued and it's not inexpensive either. It's much better to say, you know what, I'm going to voluntarily do the right thing, not only because I'm a nice person, but because people will have better outcomes. They'll come back again next year. They'll buy more tickets. They'll bring their friends. It is actually a positive economic way of doing business, as well as being healthier and safer.
All right. Great, Steve. Thank you so much. That's all of our questions. And this will conclude our first session of the day. Thank you so much to all of our speakers for taking the time to put together your slides and present to our audience. Next, I will pass it over to Barb Bousted to introduce the heat tabletop exercise as our second session for the second day of our NIHIS warm-up workshop. Barb?
Hi, I am looking for the ability to share. I think I do need to be made a co-host still.
Hey, Barb, you are a
Got it.
co-host.
Okay, got it. It just popped up. Here we go. Okay. Thank you. And by way of introduction, my name is Barb Baustad, and I am a member of the NIHIS team as our Heat Services Program Manager. I've been with that group for a couple of years, but for a couple of decades before that, I worked with the National Weather Service. And one thing that we strove to do within the National Weather Service was practice realistic scenarios. As both a person practicing them as a forecaster and as a person leading them in training, the benefit of thinking through things in a realistic scenario, even if we can't actually discuss it, helps some of these concepts stick. We've learned a lot of things over the last session and a half, and I'm hoping we can apply those things as we go through some of the challenges that could face particular heat events. So I am going to start with a Mentimeter, and let me put this up as a full screen. If you are on your laptop, you can enter the Mentimeter, www.menti.com, enter the code 35838638. You can also use the QR code to scan in and join the Mentimeter. We're going to use about 10 questions in Mentimeter, so it's going to be an important part of how we interact, since it's impossible with this many people to let everybody have microphone access and try to talk it through. So I'm going to vamp on this slide for just a moment more so that folks have time to get logged in and join me there on the Mentimeter. We are going to go through a heat scenario that takes place in mid-June across much of the United States, as it turns out, but we will focus on 2 locations. And we're going to go and peek at its forecast, and then some very realistic events that occurred during that heat event, and how we may have approached the events if we were in some way involved. So however you are coming to a heat scenario, whatever your background is, I would like you to think in that frame of mind as you go through this exercise. How and when would you be making decisions? What kind of decisions would you be making or recommending? And if you're on the information provider side, how and when would you be providing the information to feed those decisions? So to the best of your ability, go ahead and participate in whatever way makes the most sense for you. I see our numbers continuing to climb, so thank you all for joining. I think I'm going to go ahead and start. Okay, now my first question will come up as a word cloud. Just in 1 or 2 short words, what tools and inputs would you utilize, or do you utilize in your decision process when you are looking at potential for extreme heat during outdoor events and activities? Okay, good. We've got some jumping up right away. Heat risk, wet bulb globe temperature, yes. Weather service, weather app, weather reports, meteorologists. Oh, good, good, good. I love seeing this come together. You can input as many of these as you want. So if you want to make one of these go even bigger, just put it in and it'll continue to amplify it. Continuing to watch things come in. Heat risk, wet bulb globe temperature, heat index, NWS, forecasts, data, humidity, all kinds of answers coming in. So thank you for joining. Thank you for putting your answers into there. I don't want to neglect some of these smaller, smaller type options that are coming up, meaning maybe only 1 or 2 people put it in, but it was important enough to mention. So it could be things like folks who use heat.gov, heat advisories, number of medical staff, event organizers who are a part of your input, ICS policy, airflow, sun. Thank you for keeping these coming. I am not very surprised which tools and inputs sort of rise up to be prominent, but I like to see how the collection comes together of what else folks are using. And in our summary of this, we're going to dig into and try to document some of these, perhaps lumped together, some that are similar but weren't the exact same words so that they didn't show up together. All right. Great. Slack. Some folks are using Slack to communicate. Chance of rain, part of it. Acclimatization or acclimation. State Health Department information, geography. Oh, I see state climatologist rising up. That's great that you are using your state climatologists as a resource. They are a wonderful source of information. Okay, I'm going to go on to the next. There's still stuff coming in here. You can go back and enter, I believe, if you want to, but let's move on to my next question. My next question is, just in general, how many days in advance of a heat event can you make these decisions? In other words, if you are working with an outdoor sport or activity, how many days in advance can you do these things? We've got as low as 1, which is like the day of the event, as much as 10 or more. So click in there and it'll show up here with a little heat map to show where folks are answering. There we go. Folks are starting to show up. And what you'll see are a couple of bubbles that will start to pop up for these. So for instance, moving games to earlier morning or later evening, there's a bubble there showing up of around 4 or 5 days, but smaller bubbles out a little bit longer. Okay, keep those answers coming in. Again, that is really helpful. Some of these are nearly flat or show small rises at a lot of different timescales, which to me indicates that we are able to make those decisions at a number of time ranges, depending on probably things like resources, forecasts, confidence, and things like that. If there are other actions or decisions that you make when you are looking at a heat event, we have an other category. I would encourage you to type in your other. You can put it in the Q&A, or I believe Morgan was going to open up the chat. All right. So some of our decisions are happening all across timescales, such as moving games in time or procuring extra physical resources, I'll say. Water coolers, misting sprays, shade tents. Communicating heat risk to athletes leans a little bit more toward that shorter scale, the days 1 through 4, but some communication is happening a week out and 10 days out. The chat is now open, so if you've picked on other, I'd love to know what your other is. Reallocating first responders to potential hubs of activity seems to be something that's done in the days 1 to 3 time scale, a little bit later out, but that does lean more heavily into very near term. And one of the others that popped up in chat is to cancel the event if heat is forecasted to be extreme. That makes sense of why that one would be the day before, day of the event. All right, I'm going to move on to the next question. How confident do you have to be in a heat wave that will be occurring in 7 days, a week out, to go from awareness that you're paying attention to it to action? You are starting to make phone calls, you are starting to reallocate resources, perhaps move game times, some sort of concrete action. I'm letting answers come in there, and while they are, it's important to remember that at 7 days, forecast confidence is just by nature lower than it would be at 3 days in advance. So if the forecast confidence is about 60 to 80% at 7 days, that's actually a pretty high confidence of there being a heat event. I do notice here that folks don't seem to be waiting for that like 80 to near 100% confidence that decisions start to be made in the neighborhood of, let's say, 50 to 75% confidence. That is very interesting how those jumped out fairly quickly. And we still have some answers coming in, so I'm going to let those bubble in just a little bit more. That middle 40 to 80% is really neck and neck there. All right, let's have the same question, but now we're 3 days in advance. How confident do you have to be in a heat wave occurring in 3 days to go from awareness to action? At 3 days, it is a little more possible for, or a little more common for us as forecasters to have that higher confidence in the event happening. Now, just because the forecasters have higher confidence, that doesn't always mean that you do if you are the person who is receiving and making decisions on that information. But we have a strong leading candidate here that we're looking at about a 60 to 80% confidence. If you're 60 to 80% confident, for most people, they will go ahead and take some steps, concrete steps, to mitigate the risk. Okay. Wonderful. Thank you. I still see a couple coming in. So, all right. I'm going to drop out of the Mentimeter and go up to my slides here and talk to you all a bit about a particular scenario. Let me go into full screen here for you. So let's look at a potential heat event, June 20th to 26th. This is based on a real event, but I don't want you to get worried about the year that it occurred. Just imagine it being any year. And although I'm showing the 8 to 14 day outlook for June 24th to 30th, the heat wave is actually in the forecast for June 20th to 26th, and it's been consistently in the forecast. There is on this map a high risk of extreme temperatures, which indicates a 60% or greater confidence at or past the 10-day scale for this event to occur. So quite high confidence. And it's a weekend event here in the central United States, working into the work week as the heat wave moves east. Our National Weather Service has issued key messages for this late June heat wave. This issued on the 18th, which would be just a couple of days ahead of the earliest parts of this heat wave. The first parts of the heat wave bring major to extreme heat on the heat risk category across parts of the Central Plains, Nebraska, Kansas, over towards Chicago. And then as the week goes on, that risk spreads into more toward Pittsburgh and the mid-Atlantic, and then over to the Metroplex and Atlantic coast. Okay, I'm going to show you a series of maps. So let me orient you to these because we're going to look at them for several days. So this is the forecast for June 21st. That is the Saturday of this weekend. And I'm highlighting in particular the values at Omaha and Philadelphia. So at the upper left, the high temperature is forecast to be 102 in Omaha, 90 in Philadelphia. Low temperature forecast, 81 in Omaha, 69 in Philly. The heat wave isn't quite there yet. So that leaves a max heat index on June 21st of 109 in Omaha. The category of wet bulb globe temperature has reached the extreme category. The heat risk at this point is also in the extreme category. And the probability of major or greater heat risk, in other words, major or extreme, is 100% in Omaha. We are highly confident in this heat wave occurring. On June 22nd, the heat still lingers in the Omaha area. We're seeing that high of 101, low of 80, heat index 107, still in the extreme category for both wet bulb globe temperature and heat risk, and near 100% risk of the major or higher heat risk category. As we move to June 23rd, we're going to shift our attention to the east as that heat wave works its way across. It is actually really centered on June 23rd on Illinois, Indiana, Ohio, in that area. And as we get into June 24th, now we are looking at a high of 99 in Philadelphia, a low of 77 with a max heat index of 104. We are in the extreme category for the wet bulb globe temperature, in the major category for heat risk, and the probability of major plus is 100%. And while the major is on the dot there, that extreme category is around, and there is still some risk of that occurring. So again, we're going to start with our focus first in Omaha. The National Weather Service is communicating major category of heat risk on Friday, extreme for both Saturday and Sunday. We get our relief there on Monday. But when we look at the probabilistic heat risk, you can see that with a day or two of notice, that probability of being in the extreme category, we've got about a 20 to 25% and essentially a certainty of being in the major category. Because of that, the National Weather Service has issued an excessive heat warning in advance of this heat wave for Friday through Sunday, noting that potential for prolonged heat, hot overnight temperatures, and in big letters here at the bottom of their graphic, that it is an early season event. It is the hottest weather of the year so far. Now let's talk a bit about Omaha and why I'm focusing on it, other than the fact that I live here. So I'm going to focus on Omaha. It is that little dot in the middle of the little box. Well, the weekend of June 21st to 22nd is a very busy one in the Omaha metro area. I'm going to zoom into it there. First of all, the Men's College World Series is going on that weekend. This is an event that is well planned and well prepared for in advance. The national championship games are occurring in that weekend, scheduled in the afternoon on Saturday, Sunday, and if needed on Monday. The event includes a fan fest with vendors and activities for families. There's also what I would call a vibrant tailgate culture. Lots of folks who are tailgating on the streets and in parking lots on asphalt. There are beer tents and beer patios, again, set up in parking lots and on asphalt. And there are downtown bars with ridiculous drink specials and other shots competitions. The venue itself serves alcohol. It does have an air-conditioned room that somebody can request to go to if they are becoming overheated, but it's not just publicly open and available. You need to request it. There's a first aid room as well. The venue allows attendees to bring in empty, clear bottles to fill with water in the stadium. There are a couple of water fountain stations, and they've added a couple of water coolers for the event. It is the NCAA that makes the decision to delay or postpone games because of weather. The state, and county EOC, Emergency Operations Center, is activated, and there are first responders deployed on site. They are probably already staffed up for heat. Now, that's a big enough event as it is. But, and I should mention, there are tens of thousands of attendees, even though this is the championship game and most teams have already gone home. But in addition to that, there is a youth baseball tournament. And on the map, I've highlighted the location of most of the fields where the youth play. It's called Slump Buster, and it attracts over 700 teams from all over the country. Now that's spread out over 3 weekends. So this particular weekend, about 260 teams and about 3,000 plus players, plus all of their coaches, parents, and travelers who come with them. There are actually 40 venues where these games are played, and a lot of these are not like very fancy baseball complexes, right? These are not high-end baseball complexes. 2 or 3 of them are on turf, the rest are dirt. These are the kind of complexes where there are 4 baseball fields together in a cluster, maybe 8, and there's not a lot of shade. There certainly isn't really shade structures for those who are watching, and there aren't trees near the fields. Most of them are wide open. Most of these do at least have covered dugouts, and most, just about all, have a concession stand. That is a building, may or may not be air conditioned, with bathrooms that may or may not be air conditioned. They will have a first aid tent on site, but most don't have any other kind of cooling tent. And there are no written rules by the Youth Baseball League in this area on thresholds for delaying, postponing, or canceling games for any weather element, including heat. It is the ump's judgment call. The umps for this tournament range from veterans and retired folks to teenage ball players doing some extra stuff on the weekends. There are other activities going on around the city too. There's a Juneteenth Joy Fest in North Omaha. There's the Tacos and Tequila Festival, a couple of 5Ks. It is an extremely busy weekend. And hopefully I have set the stage for it, that this weekend is crowded with things going on. Well, let's go back to asking some questions through Mentimeter. For each of these 6 potential actions that you could take the day before this big weekend starts, I want you to rank both their cost and their impacts on a scale of 1 to 10. So for instance, if you think it's highly effective to cancel an event due to heat, it probably is, it removes the exposure, but it has a high cost, it probably does. You would rank both the impact and the resources closer to the 10s, and you're going to end up in one corner of this diagram. And again, if you do a something else that you note in the comments, or if you do a something else, it would be helpful to note in the comments what those might be. So this might take a minute to go through as you think about it. You're thinking about sort of your cost loss scenario, if you will. You're thinking about what kind of moves you can make, knowing that you don't have unlimited resources, right? It would be great if we could tell Slump Busters to come back next weekend, but we can't. All right, and you can see how the dots are coming in and folks are rating these potential actions that they can take. As folks respond, you see the dots moving around. One thing I'm noticing is that just about all of the actions have a fair amount of impact. But some of them certainly cost a lot more to do, like canceling the events, like procuring and distributing materials like tents, misters, and fans. These are complicated to answer and take some time, so I am going to give you a moment here to go through these and do your answers. And I really would love to know if there are other things you might do a day before an event like this to mitigate that risk, that exposure to the heat hazard. So please do let me know in the comments if there's anything else you can think of. Excuse me. Okay. Communications actions. Yep. How are you letting people know? Group texts via cell phone or city offices or university systems. That's another good one. We're going to have a more communication specific question here in a little bit too. But communication certainly is an action you can take. And if somebody rated communications down here, what I'm interpreting is that it is low on the resources. It doesn't cost much to communicate things out, but it also might be lower on the impact, perhaps, if that's what I'm interpreting. Has anyone ever heard of having having event participants sign heat awareness or heat risk waivers, for example, as they enter the gate or when they buy tickets. I have not heard of that. That would be an interesting way to go about it. Yeah, making sure there are extra medical services, right? That could go under staff for sure. By the way, this is really cool. When I mouse over any one of these, you see where folks' answers have distributed. Here we go. Moving the event time, procuring and distributing extra things, setting up extra water coolers. Lots of folks saying that that is a very high impact, which is good to see. Speak with the hospitals ahead of time in case they start to see cases of heat-related illness. And hopefully, perhaps even doing that at an earlier time frame so that they can staff up and adjust their own staffing accordingly. Setting up the cooling stations and making sure cooling stations are already prepared across the city. Great, great, great. All right. So again, I'm just going to scan through some of these. Here are where the individual dots have been falling. Canceling the event, moving the event time. General agreement that it has a pretty high impact, a general disagreement on what the cost of it is, and it probably depends on the event. Procuring and distributing tents, misters, and fans. Fairly heavy lean toward it costs a fair amount, but also some lean toward it having an impact. Setting up extra water coolers, high impact. And then a couple of high resource, low impact, a couple of high impact, low resource. Okay. I'm going to go ahead and keep moving now past this complicated question. Now, here's the thing, okay? If you are in the Omaha area working in some form of decision making, you do not have infinite resources to put everywhere you want, right? It would be great if we had an ambulance stationed at each of the baseball venues that we saw, but we just don't have the resources for that. We don't have the resources to open up, cooling tents at each site. So when you think about these biggest events that are scattered around the metro, what % of your assets would go toward each of these things? And just for now, this is your full 100% that you're dividing between. I know there's other stuff to worry about too, but we have the College World Series Fan Fest and Crowd. You can assume that the athletes are being taken care of. The the Slump Buster attendees, vendors, concessions, support staff, all the folks that are off the field. Slump Buster athletes, coaches, and umps, the ones who are on the field. Not safe to assume that they're being taken care of. And then finally, let's not forget that Omaha and the county it is in, Douglas County, has its own population to worry about. There are unhoused people, there are low income, elderly, non-English speaking, and other populations that also may need some care and attention too. It's not an easy question, right? It's not easy to think about how to take care of all of these different folks. Oh, and I'm seeing, I see the comment that came in for an other on the last slide, regulating traffic, reducing wait times for entry, providing medical spotters. All really good ideas. Thank you. Okay. As the answers are coming in, I'm seeing some preference here toward the College World Series Fan Fest and Crowd, a large concentrated group of people that are vulnerable to the heat because there isn't much shade, because they are on asphalt, because they may or may not be consuming alcoholic beverages. And they too may contain some vulnerable populations as well. Children who attend this, retirees, folks who have sensitive health, certainly are among the attendees there. As things are settling in, and continue to bring your responses in, I'd love to see them continue. Attention to the local residents is still important, making sure that there are cooling centers open where those folks can access them, for example, not taking all of the resources away from the residents to go put into baseball fields. The next one that rises up is taking care of the attendees, vendors, concessions, and support staff of the Slump Buster, that youth baseball tournament. And then finally, the athletes, coaches, and umps. My thought there on why that might be coming in last, and someone can correct me if I'm wrong in the chat, is that probably the parents are watching out for their athletes and helping take care of them. And they are a little more spread out. So they have shade. So maybe the assumption there is that they are being taken care of. And so the county and city resources can be spread to other things. Is that a safe assumption, that why that one's coming out lower? All right. Like I said, feel free to disagree with me in the chat or the Q&A. Thank you all for responding to this. And the assumption that those athletes are already acclimatized better than the other folks might be from their practices and other games and such. Yes, that is also a good point. Slump Buster attracts participants from all over the country. A lot of them come from places like California, Arizona, Florida. But by and large, they've been playing in the heat into the summer already. Okay, one more question here. This is going to be a free answer question, and it might be hard to see some of these as they fly by, but I'm going to give it a go anyway, because these will be logged for us to look back on as we summarize this workshop later. So what concrete actions would you advise to be better prepared for future heat events during this high intensity weekend of overlapping events in mid-June? Happens every year. To build resilience into the future, especially as we experience more heat like this. All right, here we go. We're starting to see some answers pop in. You have the ability to, I think, upvote the ones that you agree with, so you don't have to retype them. Have shade available. That is a great one, and something I think that could be addressed in the long-term planning. Why aren't there shade trees near some of these baseball fields? Or shade structures? Plan early and adjust constantly. Ensure traffic flows steadily. Look at historical data and plan for slight increases to the number of cases. Look at seasonal forecasts. Ooh, here's a good one. Prepare large-scale exercise and training to help all the involved parties better understand the needs of each group. A couple folks talking about hydration, several folks talking about hydration. You all were listening yesterday when Kara gave us her words about hydration. Yeah, do after action reports to see what could be improved on. Yes, plant trees. EMS personnel on site. That certainly happens at the College World Series, not so much at the youth baseball events. Guidance given to spectators, especially families. Sure, people bring their young siblings and grandparents to events like this, right? Awareness campaigns, mist stations, signage, free water. Yeah, great stuff coming in. Light colored clothing and thin clothing. That could include the uniforms for the players too. Another one with tabletop exercises, much broader versions of what we're doing now, where folks can really lean in on the roles they have and their contributions to a scenario and learn from that. And probably worth mentioning here regarding tabletop exercises that NIHIS has a history of supporting tabletop exercises across the country. We hope to continue to support a couple this year and next year. So stay tuned, and hopefully we'll have more messages about that. Okay. Pre-plan with first responders for who has capabilities. Bulk ordering simple neck fans and personal misters. Messaging for early warning signs of heat illness. Build-in breaks for volunteers and staff. Spread the events out. Understand the uneven distribution of heat across the city. Also very helpful. Omaha has had an urban heat island mapping campaign, as have many cities around the country. So you can go to heat.gov and see if it has been done in a city of interest to you. And if not, again, we may be able to look for opportunities where NIHIS can support urban heat island mapping campaigns in the future. Assume all summer events are a heat risk by default. Yes. Okay, I'm going to move on from this. So many great answers are still coming in. Thank you for continuing to add them. You can continue to add them as I switch back to the presentation, because I do want to give a couple of minutes to talk about Philly. What's interesting about this Philly case is, as we've been thinking about Omaha and its preparations, 1, 2, 3 days in advance, Philly has had a week's notice that temperatures are likely to exceed heat index readings for an excessive heat warning, and that the heat risk category is likely to be in that highest extreme category. What can they do with that much notice? What can they do with that much information so far in advance? Now, this happens to be a midweek heat event for Philly, so there isn't as much going on in the sports world. The Phillies are playing out of town, but the Chelsea Football Club is in Philly for the Club World Cup match. The game was already scheduled at 9 p.m., so it's already a late game. But they had to cut their June 23rd practice short, which made the news, made some waves there that it was pretty hot. And some of the players and staff didn't feel like there was a lot of support for the heat there. Other than that, just a couple of small activities going on. A summer fest, a dining under the stars. You can assume that there's a smattering probably of some youth sports like baseball and other outdoor activities. But it isn't quite as packed of a time period. Philly, thanks to the Philadelphia Department of Public Health and Office of Sustainability, has a Philadelphia Heat Vulnerability Index, which has mapped out the neighborhoods that are especially prone to heat impacts, either because they are hotspots or because their population is sensitive, or in some cases, both. Just for note, that little circle down there is where the football game is taking place, at the football field. That's 2 different types of football for those who are keeping track. So, thinking about this situation in Philly with so much notice, here we go. What are some means that you could use to communicate that extreme heat potential 5 to 7 days in advance? And again, there's an other there. If there are other means you can think of, please throw them in the comments. I can only put so many options in here. What means would you use to communicate that pretty exceptionally confident risk of heat 5 to 7 days in advance? Okay. Seeing lots of things come in, an email blast to stakeholders, social media posts. That's still a great way to get people's attention. Webinars or conference calls with stakeholders. That's two different ways to reach the stakeholders, those who may be able to communicate your message forward or may be most affected by it. For instance, partners in healthcare, partners in public safety. There's a question in here. What would an email blast entail? Often the email blast contains a PDF, a couple pages maybe, of information like, here's the heat we are expecting. The heat risk is most likely to be in this category. Here's the timing. So it's essentially a written version of what might be put into a webinar or conference call. It mainly is pushed out, but often there's an invitation to contact folks with questions. Whereas in the webinar or conference call, those questions will come in real time with some discussion. Okay, so we have this communication potential 5 to 7 days in advance. Does it change 1 day in advance? So what communication would you use 1 day in advance? Okay. So we're seeing that some of the messaging really changes. Some of the formats of messaging really change with that shorter time. When we're looking at a more immediate threat, that the folks who are responding here are indicating that social media posts and press conferences might be the best way to get this out to folks. It's going to get it on the news, get it into people's feeds, because let's face it, most people are getting their information here, right, on their phones. It's how people collect their news, and it's how people collect their weather in a lot of cases. People standing at the gates announcing heat concerns. That's like a town crier approach. Hear ye, hear ye. It's going to be hot. Did you bring water? I will tell you, I tend to attend the College World Series and also the Big Ten Championship, which is played the week before the College World Series starts here in Omaha. I am fairly light complected, and I forgot my sunscreen one day, and I was definitely burning. I was trying to shade myself with like my clothes and different things. I was trying to like lean and cover so I'd only expose one side at a time. It wasn't helping much. And bless her heart, this one usher woman had holstered with her sunscreen, and she, whipped it out of the holster, handed it to me without me asking, and said, looks like you need this. So having folks like the ushers be also something of caretakers looking out for folks who are exhibiting signs of heat is also a great idea. It is a problem that some events don't allow you to bring in bottles. I am seeing more and more that they will allow empty bottles that can be refilled. And hopefully at least that's a trend that continues. Oh, I love that. Yale created sunscreen dispensers on their campus. A simple but great idea. Okay, so we are at time, and I'm just going to leave with a couple of thoughts. Different stakeholders and people have different thresholds at different lead times. So what's most important is knowing what your thresholds are and what your partner's thresholds are for action. For information providers, those who are pushing out information about potential resources, it may be on you to proactively send a heads up about potential heat coming in. Folks sometimes don't know what they don't know, and it's helpful to provide that information and not wait to be asked for it. And for those who are using and interpreting that information, it will help you make your decisions if you ask for their confidence in that information. How confident are you in that forecast? How confident are you that you can obtain 10 misters in time for this? Confidence helps us assess what we can potentially do and what the risk is if it turns out differently. I will happily address anything in the Q&A that comes up. I'm going to be around. I know we're out of time and have a break though, so I am going to yield the floor, and thank you all for participating. This is, it would have been great if we could talk, but without that, I really appreciate your participation in the Mentimeter and letting us look at how different people interpret what's happening.
Thank you, Barb, for leading us through that exercise. And everyone, thank you for your participation, utilizing the Mentimeter, and just helping us accumulate some great knowledge and some best practices. We are going into a break. You have about 12 minutes in this break, and everyone, please return at 2:45 p.m. Eastern, where we will jump into the heat response case studies. Thank you.
Hi, everyone. We'll be coming back from break in 1 minute.
Check, check, check.
Yep, we can hear you, Spencer.
Okay. And okay, cannot start video. Aha, start video. There we are. Good. Whew.
Hey, everyone. It is 2:45 p.m. Eastern, so we're going to go forward with our final series of presentations before the closing keynote, and we end our 2-day workshop. So I will turn it over to Alice Lau. She is the One Health Coordinator for NOAA, and she will be moderating this next session. Alice.
Thank you, Paul. Hi, everyone. Today, I'll be moderating the last session for our 2026 NIHIS warm-up workshop before our closing keynote. This session will feature 4 exciting presentations that will showcase heat response case studies and lessons learned from outdoor sporting events, including marathons, college football games, and preparing for the upcoming 2028 Summer Olympics. I'll be introducing Spencer Atkins. Spencer Atkins is an award-winning chief meteorologist with Woke TV in Huntington, Charleston, West Virginia. As a broadcast and event meteorologist certified by both the American Meteorological Society and the National Weather Association, Spencer has been communicating weather for 30 years in the tri-state area. He has forecasted and led coverage of many major storms, from tornado outbreaks to Superstorm Sandy to major floods to derechos. I'll pass it over to Spencer. Thank you.
All right. Thank you very much. Well, my role today is as a forecaster for Drum Corps International, for Bands of America, and for Winter Guard International, marching arts. It's kind of a passion of mine, and I got into that a couple of years ago. And if you'll notice, even just one little edit that I made on the first page, case studies, DCI, but mitigating individual excessive heat injuries. I've noticed that we've been using EHI as excessive heat illness. And I would say that, and I would argue that, we are also trying to mitigate excessive heat injuries. And just as a communicator, when I deal with people, if I say, hey, we want to watch out for heat illness, and you get the nods. But if you say, we want to watch out for heat injury, you get people's attention. And so maybe that's a modification right out of the box that I would suggest as a practitioner. And I'm not a PhD. So many great, brilliant minds here today. To be included is a true honor. But we'll go through this quick case study here. Because we do deal with heat. I got brought into the DCI in particular. Next slide, please. In about 2019. And we started, myself, Dr. Kevin Clazel, who many of you know, and Tyler Hollingsworth. And we started kind of more like a lightning policy group, watching out for storms and so forth. But quickly that morphed into a heat mitigation situation. And so Drum Corps International has been very good about trying to lead the way. On a given night, this picture was taken in Atlanta. I was the forecaster responsible for that. We do most of it remotely, but I was on site. We had a risk of storms, but also the heat that day was incredible. And so we have, in this case, maybe 3,000 performers, probably 20 corps, 150 each. So that's a lot of people that are performing. And then, of course, I think we had something like 12, 13,000 people in the stands. Luckily, as you could see, the sun was behind them. But this is a tour that goes across the country, 80 to 90 events a year. And it seems like, well, all the spots are hot, but in particular, California, Texas, Oklahoma, the heat and humidity of the Southeast and so forth. So there's a lot of places that we have to deal with the heat every day, every night. Next slide, please. And so the daily heat challenge is obvious. You're on turf in most instances. You're talking about sometimes the daily just air temperature is 105. Surface temperatures in Oklahoma have been read above 170 to 180. So that's a part of the discussion too. We're not just trying to work with wet bulb globe temperature, but we did a lot of work this past year with the actual surface temperature, and we put in a threshold of 160 degrees as the no-go. And then we wait until it comes back down to 150. We don't need people getting burned on those surfaces. Also, we need to think about things like props, if they're made out of metal and getting hit by the sun, like what's the temperature of that? And we suggest PPE for, gloves, sleeves, things like that, so we don't get burns. There's a lot of different things that we're looking at. The wet bulb globe temperature readings, that was modified to 92. This was 2 years ago. We were using 90. We went to 92 per UIL. We kind of work hand in hand with so many of these different units, and that seems to be within the marching community, the threshold that we can get buy-in with. Rehearsals on the field can run for 2 to 3 hours at a time in the maximum heat. And one thing that has occurred, some of the units have been deciding to shift that maybe to an earlier part of the day, or maybe change that to the evening if they're on a remote site where they don't have any noise regulations, things like that. And exposure, as I mentioned, to turf and props, which are often made of metal, that can be a problem. And so we're always cognizant of that. So next slide, please. And, every day is just a challenge as we're out there with the tour. This is the heat action plan, a sample from, I believe this was 2 years ago. And you can see it's robust. I mean, we went from, oh yeah, we got some problems with heat. What do you guys suggest, to this? Of course, Dr. Clazel helped really develop this, and there are great ideas from other entities, like I said, like UIL and so forth, but it's robust. And number one thing is you got to have a plan. And so many people have said a plan, a policy. This is our policy. And so we go to all the events with this is our policy. We talk about it, we study it, we share it, we learn it. Next slide, please. And again, you can't have enough policy with that. And that helps you get buy-in in your community or your event, whatever it is. So we talked about in that last exercise, how many days ahead? We're usually looking about 7 days out. Of course, those of you who deal with convection allowing models know that that's not really possible. When we're dealing with heat, it is a little more possible. On-site readings are taken before and during the event. We've gone to Zealous WBGT app, and we do have Kestrels too. And sometimes you can kind of balance them both, but our primary with Drum Corps International is a Zealous WBGT app. Let's see, field turf temperature readings are taken, of course, handheld infrared. And we kind of know, we've built a book basically and intelligence over the past couple of years. We know the sites. We're at the same sites again and again. We kind of know when the numbers are going to break in our favor. And start times have been pushed back on tour. By and large, you talk about like Texas and Oklahoma, most of our times have been pushed back past sunset, which is going to help you be in the green, or at least in a zone in the yellow maybe when you're dealing with wet bulb globe. And certainly with the turf temperature, you're going to be within limits. Next slide, please. And so our case study here, it revolves around July 8th, 2024. We knew this was going to be a deal. We knew that we had a record heat wave. And so Drum Corps International, days before, this is 3 days before, issued this and lots of social media excessive heat warnings and advisories across West Coast to modify upcoming event details for select events. And it went into, hey, we're going to push all of this stuff back. Everything is going to be pushed back so that we're going to be safe. So the Bakersfield show, no risk of rain. Next slide, please. That part was pretty easy to call. And this is our setting. And I should have put it the way it is. The stadium is actually northeast, southwest. So hopefully you're going to have a little bit of shade, but not as much as I would have liked. A lot of our north-south fields are fine because the sun will set behind the away stands if they're tall. But this is what happened that day. On July 8th, we actually had 114 degrees. Now, there was not any pushback from the Drum Corps people, and this was days ahead. But a couple days ahead, there was some discussions from they, and some of you who do events know that there's always a they, and who knows who that is. You're not talking to them directly. I'm dealing with DCI. They're dealing with whoever they is, and there was a mention of, well, they'd like to try and stay around 6 or 7. That wasn't going to be possible. So, we really had to communicate the risk, communicate the numbers. And next slide, please. Those numbers stayed up all the way through. So the messaging to DCI started days ahead. The heat risk elements were there. You didn't even really have to use that product as much as just, hey, here's your wet bulb globe. This is what the forecast is going to be for that. We're going to be above 92 throughout much of the day. Rehearsals, are really a no-go. They are responsible for their own rehearsals when not on the property that DCI is renting or hosting at. But most of them are like, hey, we understand how this goes. So hopefully they modified their practice that day. Turf was going to be well above 160. In 2024, we were using Kestrels as the default monitoring device All parties were reminded to utilize them. Every unit has one or should have one. We do run into problems with inconsistency of reading, which is another reason we went to Zealous. Readings were taken on site vigorously that day, and after discussions, yes, indeed, the show was pushed back all the way to 8:30. All the plan was going great. Next slide, please. This is when you're looking at things and you're going, this is fantastic. We got the show moved back. There's the actual lineup. Welcome National Anthem at 8:30. The sun is going to be down behind at least a portion of the stands, so the fan comfort is going to be maximized, even though the actual temperature was 105, but you know what they say in California, but it's a dry heat. The dew point was 46. The wet bulb globe actually did break because of mixing and the timing of the day. And, you know, it was fantastic. All the numbers were go, let's go. Turf temperature well below 160. We took the intermission out, so we squeezed the program. Everything was going to be perfect. And then the next slide, please. Well, we went from that great plan to this. Next slide, please. One thing we didn't really plan for was the fact that there were, next slide, please, fires around. And, you know, usually we'll talk about smoke, but there was dry conditions. There were some fires, there was some wind, and somehow, somewhere, a power line went down. So we did everything right up to that point, but the power went out, and unfortunately, that show ended up getting canceled for different reasons. Didn't have any power, couldn't run the lights, and it's kind of a, hey, everybody runs or nobody runs. So that ended up being kind of a weird instance, but as a case study, I just wanted to show that everything was planned correctly. Communication was brought forth. We didn't have to really push too hard because the messaging was great from the Weather Service. The wet bulb globe forecast was going to be way out of the range. Even if we broke at 6 o'clock, sometimes you can get that. You'll break down below the numbers at 6. But we said, no, you can't have people in the stands still at 114, 112 at 6 o'clock. We'll utilize the shade. All these things came together. Next slide, please. And then we had something that was a little outside of our control. But the key to all this was there was a policy in place. It was communicated well. People understand it. We're continuing to build the culture around the policy. Again, policy, policy, policy. And if you utilize it and it's based on science and you're consistent with it, you can build a culture. You need to be consistent with that messaging across the board. And remind your constituents this, that it's built around science. We're not trying to bubble wrap the world. We're not trying to take away your fun. But the point is not to gatekeep, it's to keep safe. That's the key. And our last slide, I think I have one or two more. Just real quick, for DCI, the show start times do get pushed back off, and that's part of the culture now. You can see that happening. Rehearsal times have been amended, and they've added some strategic, like, hey, let's take what we call nap block. Let's go into the AC for a couple of hours. The athletic trainers have their own regimen that they're following with the performers as far as taking care of them. I do work with Bands of America. It's great to see places like McAllen, Texas, which is insanely hot and humid in September. And they have, the city actually came in and brought us some cooling tents and some cooling structures so that we could take care of the performers that way. Schedules have been shortened and modified for Bands of America. And we even had for Winter Guard International, you wouldn't think that we'd have problems with marching arts, but in the winter we did. And we had in California a show that had 105 degrees. Everything that goes inside for performance is outside. So we had to create some messaging for that. And everybody bought in, including what I call the dad rule of no bare feet on those surfaces when you're out there, because we have actually seen performers get their heels burned walking across the asphalt. So again, policy helps you create culture, stay safe again. And again, it's not about gatekeeping. It's about keeping safe. Glad to take any questions or comments.
Thank you for the excellent presentation, Spencer. Right now, we don't have any questions yet in the Q&A section, but folks, if you have any questions, feel free to enter them in. From my end, I was curious. Oh, we actually did receive one. Spencer, you mentioned wildfires, but were there any plans for wildfire smoke?
Yeah, so smoke is something that we do look at. What I didn't add into the plan, or my thinking was, what if the power line gets burned or pushed down? So smoke, we do monitor air quality. We have some thresholds in there. Don't have them right in front of me, but we do monitor that. We've had some shows where we have either pushed delayed or had some, some basically, hey, if we have somebody with a health issue, they don't have to run, that kind of a thing. So yeah, on the fly, that was the one part of it that, yeah, there was probably even a mention if I pulled up my notes. Yeah, there's some fires around. There could be some air quality. We were monitoring air quality too, but just you can't foresee a power line, but I am going to try and keep that in my notes moving ahead. Hey, we could have a power outage, that kind of a thing.
Absolutely. No, those are definitely important factors and good to keep in mind for future planning. Thank you.
Mm-hmm.
Up next, then we'll move over to Stacy's presentation. Thank you, Spencer. Let me introduce Stacy Embritson. Stacy Embritson is the Vice President and Race Director for the McCourt Foundation, where she has led production of the Los Angeles Marathon since 2008. She played a key role in developing the Stadium to the Sea and the Stadium to the Stars courses and oversaw operational planning with a strong focus on participant safety. Stacy serves as the NCS4 Marathon and Endurance Events Committee and helped plan the 2016 U.S. Olympic Marathon Trials. A veteran of 66 marathons and 3 Ironman triathlons, she brings both professional and athlete perspectives to endurance event safety and operations. Stacy, the floor is yours.
Hi, Alice. Thanks everyone for having me. Very excited to be here today. So I'm going to give you just kind of an overview of what we encountered at the Los Angeles Marathon this year. As we've kind of been seeing as of the last few years, endurance events are increasingly operating in unpredictable environmental conditions. In March 2026, the LA Marathon faced a late emerging heat forecast that significantly increased risk for our participants, particularly during the final third of our race. So today I'm going to share how we use forecast data, medical planning, and some operational flexibility to reduce that heat-related risk, including a decision that generated very strong public opinion, but ultimately supported our primary objective, which is keeping our participants safe. Next slide, please. So we, as most events do, started looking at our weather trends about 10 days out. Kind of the irony of all of it to us was at 10 days out, we looked at the forecast and it was looking like lows in the 50s, high of 60, which is going to be ideal. But because it's California and things changed quickly, we checked again at 9 days out and all of a sudden we were looking at temps reaching up to 90 degrees. So with these elevated temperatures, this was very concerning to us. So we continued to monitor things over the weekend, knowing that we really needed to kind of like implement our contingency plans as of Monday of race week so that we had that full week to kind of communicate with our runners. Monday morning's updates were definitely not promising and showed increasing concern for late morning race conditions. We're fortunate in that we do work with the National Weather Service, so our weather team put together kind of a situational awareness for us so we could look to see, you know, where the temps were going to be, kind of including the wet bulb temperature with it. The wet bulb wasn't as concerning in terms of our, you know, green, yellow, and red. We were potentially getting to a red level much later in the day, but just the temperatures and just the time, the increased amount of time that these runners are going to be outside was what was really the most concerning to us. So really the important factor here was timing. So the hottest part of the day, kind of in that 11 to 2, 11 to 3 window, that lined up with the final miles of the race. So this is already where our runners are tired and slowing down. We do have a 6.5 hour course time limit for our event. So what this meant in terms of where this peak window was, like our bell curve is hitting that finish line about 11:30, 12 o'clock. So half of our runners are going to finish in these later times when we have that peak heat. Between miles 18 and 26, if any of you are runners, you're probably aware of this is when runners are kind of hitting the wall, so to speak. So this is already a time that they're more fatigued and now they're on the course longer, which with an increased exposure to this heat. What's important to note on our course as well is that these last 8 miles have little to no shade, which makes conditions even more concerning for them. So our planning focused not on just how hot it would get, but how long the runners would be in these toughest, hottest miles. Next slide. So for our heat mitigation strategy, we had kind of like a multi-layered approach. We had lessons learned from previous heat events back in 2014 and 2015. So some of the things that we do for heat contingency, this is a part of our just normal planning process. I think we'd been fortunate in that we had a good 10 years that we had real extreme conditions. But because this was just standard operating procedure for us, most of these things just already existed, and then we just had to kind of just ramp things up a little bit. So as the slide exists, anything just in normal font or things that we typically do, the bold items are the things that we added race week. We also know there's no one solution to keep runners safe in the heat, so instead we focus on reducing how long they're exposed to it and giving them multiple ways to cool down and get help. We already had strong hydration support along the route with 19 aid stations. These aid stations are about 1 mile to 1.5 miles apart. So plenty of opportunity for the runners to get water, to get their electrolyte drink. But what will be included kind of early on is our heat messaging. So making sure that we were sending out messaging through email, through our social channels. We did a lot with our ambassadors, that our ambassadors were also reaching out through social, just letting people know what the conditions were going to be. There are other races that have had these extreme heat conditions, so we've been able to kind of learn best practices from them as well in terms of the messaging side. And we find that, the more we can be open and honest and give regular communication, the better the runners feel kind of going into the event. One of the other standard things that we do is I have what are called zone captains that we put on the course. So I have 4 box trucks on the course with additional water, cups, electrolyte. So if we are in a situation that we do have an aid station that's running low on supplies, we have those mobile resources to restock. So this has been like a just in case kind of scenario for the past 10 years. And we basically load the trucks, send them out there, nothing happens, the trucks come back, we unload them. Knowing that this year was going to be significantly different, I did work with my zone captains very early in the week to let them know that, hey guys, this is going to be a thing. You're going to have to help to resupply the stations, which did end up happening kind of in the later stages of the event. Other things that we added, we had a water tanker truck on standby that we parked at mile 20. Part of our water station, sustainability is a very important focus to us, and so we use these big water monster tanks as our water reservoirs at most of our stations. So if they are used up, there's no water left, as opposed to having extra gallon jugs of water. So we did have that water tanker truck that was available to refill water as needed. The other thing that we did is we included some of these water monsters at the finish line. That way, if people wanted to refill their water bottles, there was that capability to do that there as well. We added, or one of the things we do have cooling options available. We do make sure that every single water station does have a hydrant next to it that has been flushed, tapped, ready to go to hook up a garden hose to it. So this is kind of a 2-part thing for us. We can use this as additional water again if we need that backup water. But generally what we do if we need it is we hook up the garden hose, put a nozzle on it, and now we've got ready to go misting stations at every single water station. We also implemented having ice towels at the finish. Again, this is something that we always plan for, we always budget for, but in a cooler year, we won't send the towels and the extra ice to the finish lines. But this is one of those years that we knew that we would have to have all of those extra things. We do have also 9 course medical stations and 2 finish line medical, so plenty of medical resources out there. All of these stations are equipped with ice. But with the increased heat, we doubled the amount of ice at every water station, doubled the amount at the finish line, which allowed us to do like the taco rapid cooling capabilities, had an ice bathtub at the finish line. And then in a moment of panic at 7:30 in the morning, I called the ice company and had them bring in another 10,000 pounds of ice, just so we had more than enough at every location. The thing that we added this year that we've had the capability for but never done is we introduced an early finish line at mile 18. So runners that at mile 18, if they just weren't feeling it, they could peel off, go to the normal finish line, call it a day. We're set up to do this because we have a half marathon that's a part of our event. And this is just the natural half marathon finish line. This proved to be a very controversial and talked about part of the event, but ultimately, I mean, this is runner safety to me is most important. So letting runners finish early was, I think, the right thing to do. Okay, next slide. All right. In terms of our race day outcomes, of the about 22,400 people that we had start the race, we still had 21,933 finishers, which is still a very high amount considering how hot the day got. We did see that our later medical stations, particularly medical station at mile 22 and our finish line, did have a spike in terms of the amount of runners they were seeing. About 2,100 individuals received some sort of medical help. Most of these issues were very minor and typical for running in warm conditions. So we saw a lot of dehydration, nausea, dizziness, fatigue. Of the 2,100 we saw, 16 people were transported to local hospitals and all were released the same day. Most importantly, we had no fatalities. We went into the weekend expecting probably 30 plus transports based on what we had seen in the past. But we'd like to think that because of the measures that we put in place, that we had far fewer that needed that transport capability. For the mile 18 early exit, 985 runners used this early exit, which is 4.5% of the race. This helped them avoid the hottest part of the entire course. Kind of a side note to this, another reason that we did this is we work with an organization called Students Run LA. So Students Run LA, you have 3,500 middle school and high school kids running the event. These are kids that they do a fantastic job of training, but probably haven't had the experience in the heat. So really looking for this population in particular was, again, why this mile 18 was so important. And so again, while this decision sparked very lively discussions on social, it did reduce the number of runners exposed to that intense heat. Next slide. Lessons learned from our event. Heat risk really just isn't about how hot it gets. It also just depends on how long the runners are out there and when they're hitting that hottest parts of the course. Using multiple strategies together helped reduce this risk without changing the overall race experience. Giving the runners clear information at regular intervals and giving them options help them make safer decisions. And then communication is key. We couldn't have done this without the help of the weather experts that we have, our medical teams, the fire department. It was really all of us working in conjunction together to make sure that we had the support that we needed from start to finish and all of the comms going out to all of our runners throughout the week and throughout race day. So as weather becomes less predictable, planning for heat is really an essential part of that running safe events. So in closing, our objective really wasn't to eliminate the risk entirely. That's not going to be possible in endurance sport. I know we heard Spencer say, you know, in some other events, it's a lot, I don't know if it's easier. It seems a lot easier in a stadium event where you could cancel the event, postpone the event. That's not something that's very easy to do with endurance sport. But we worked to reduce this preventable risk through planning, communication, and operational flexibility. And as climate conditions continue to evolve, we're going to have to continue to adapt our safety frameworks. So hopefully sharing this experience contributes to a broader learning across the industry. And that's all I have. Thank you. And open for any questions.
Thank you, Stacy. That was an excellent presentation. I think with your expertise from as an athlete, but also as a professional in this field, I think it's really valuable and you truly represent both sides.
Thanks, Alice.
Yes. I don't see any direct questions yet, but I have one from my end.
Yeah, go ahead, Alice.
I was curious, you had mentioned with Students Run LA, because they are like a younger audience, have they ever been engaged with as trusted messengers for this type of work? And especially to reach like other young audiences who are interested in running, but also need to be aware about heat safety practices?
I'm not sure how to answer that question. I mean, we have this established relationship with SRLA. They, you know, kind of their sole why they exist is to be a part of our event. So they've been a part of the race for 30 some years. And it's such a fantastic program in terms of teaching these children about goal setting and everything is possible. And, 99% of these kids are kids that are going to graduate from high school and go on to like a post-secondary. So they do actually, yes, in a sense, they are kind of the voice for us and helping us bring this younger generation into running. It's the heat aspect of it that tends to be a little bit different, right? I think because they're younger runners and maybe a little bit more inexperienced runners, I mean, it's not even just because they're children. It's like, it's going to be true of any first-time runner that just, you don't know what you don't know until you start running under these extreme conditions. But one of the things that we do, that our coach tries to share is when not only SRLA, but other runners are doing their training is, train at different times of the day. Make sure train in the rain, train in the heat, train in all conditions because you don't know what you're going to face on race day. And I do think that SRLA and their student leaders do a great job at really trying to share that information with these students and have them as prepared as they can. But it's definitely a great learning experience across the board.
Thank you, Stacy. We have some more questions trickling in. There are some questions. Oh, sorry, I heard someone. Okay. So one question was, any chance do you know the ages of those that were transported, younger versus older? And another question, what suggestions do you have to help become more informed about extreme heat and plan accordingly?
Can I take it this time? I wish I had the numbers exactly for the heat. I think it ranged for, not all of the transports were heat related. We had a couple like sprained ankles, some other non-heat thing, but it wasn't necessarily concentrated towards the students that were being transported. It was kind of all age ranges is what we saw. Second question, to be more prepared, was that what the question?
Yes, for race directors across the
I'm
country.
a race director. Kind of what's nice is the running industry is very small. And we're all very willing to share ideas and best practices and lessons learned. I think if there are like race directors or like folks that are new to the industry, don't be afraid to reach out to any of us. Like, whatever, rising tides raise all, or whatever, raise all ships, however you say that phrase, but we want the best running experience for all runners across all events. So we try really hard to work closely and communicate. And there were lessons learned when Chicago had to cancel their race back in 2007, 2008. There were things that Chicago learned that they shared with the rest of us. And anytime that, at least the larger races, we do have these heat events, we're making sure that we're sharing what we're doing with our other race director friends. And would just highly encourage, just reach out. We are here to help. We want to help you. We want you to be prepared because runners should have a great experience no matter how big, small, whatever the event is.
Thank you, Stacy. We are at time, but there was another question asking, people were curious as to why there was backlash. Was this because the runners still got their medals and recognition?
It was because they still got a medal at 18. And I would call them the real runners. Were very offended that we would allow runners that didn't finish the full marathon to get a medal for going 18 miles. I got emails to my personal email telling me it was a slap in the face that I did this, but from people that didn't even run the event. But the reality was like, I didn't have the staffing capability at the finish line. And what am I going to stop people and be like, oh, did you run 18 or 26? Oh, no, sorry, you can't have a medal. This is the runner, they chose to leave early. They could also choose to get a medal, not get a medal. That was up to them, right? So it wasn't like we recognized them in the results as finishers. They didn't get official finisher certificates. We just wanted to do what was right by being safe. And if they want a medal, take a medal. We've already paid for them, but the real runners out there did not agree. And there was very big feelings all week, but I think it's a lot funnier now, but I stand by my decision and I'm glad that how everything turned out.
Thank you, Stacy. Up next, we will have Chad Schaefer, so I will introduce him. Chad Schaefer is the Science and Operations Officer at the National Weather Service Forecast Office in Kansas City, Pleasant Hill, Missouri. Chad was a forecaster at the Las Vegas and Mount Holly Weather Forecast offices before becoming a Science and Operations Officer at the Spokane Weather Forecast Office in 2022 and the Kansas City office in 2024. Chad specializes in severe weather, mesoscale modeling, and meteorological statistics, but given his experience in Las Vegas, he has an affinity for extreme heat-related fieldwork as well. Chad, the floor is yours. Thank you.
Thanks, Alice. Can you hear me?
Yes, we can hear you.
All right, very good. So I'm going to talk about an event that I actually was deployed to as a Decision Support Services forecaster last fall, the University of Missouri football game on September 13th. And you can go to the next slide, give you a little bit of logistical background about how this works. So the University of Missouri is actually in Columbia, Missouri, which is about the midway point among three offices in Missouri: St. Louis, that actually covers the Columbia area, Kansas City, which is the one I work in, and Springfield as well. And so because of its location, we tend to actually share on-site deployment duties each year for DSS related activities associated with the home games for University of Missouri football. And I was the lucky recipient to go on the September 13th event last year, which ended up being a pretty impactful heat event, which I will detail shortly. In the lead up to the game, St. Louis provided several DSS related forecast packages and briefings. And as you go to the next slide, the heat context of this event was actually well forecast well in advance. It actually ended up being one of the more notable heat events of the entire year for the state of Missouri, which was actually a rather modest year in terms of maximum temperatures. The week-long period in September, which is sort of highlighted in that black box on the right there, was the most anomalous period maximum temperature-wise associated with the heat risk categorization that you see from the historical heat risk graphic here. But it was actually a fairly noteworthy summer heat-wise in Missouri, despite the rather modest-looking number of red days denoted on the maximum temperatures. And that's actually because of the minimum temperatures, which were anomalously warm for much of the summer. And so heat-wise, it was still actually a fairly noteworthy summer for the Missouri area. But in terms of high temps, this September period was the most noteworthy for us locally. Next slide. So go back one slide, please. So leading up to the event, more specifically, it was very much an above average period, highs in the low to mid 90s in Columbia on 2 days before the game to the day of the game, which was about 10 to 15 plus degrees above the high temperature averages for that time of year. Low temperatures were in the low to mid 60s on the days leading up to the game, which are only about 5 degrees above average. So this was definitely a daytime heat event sort of deal here. And the minimum temperatures were a little bit more comfortable. Next slide. So like I said, this was a well forecast event, and it was well forecast many, many days in advance. And so the decision was made by the University of Missouri to move the game as a result, in part of the forecasts. I'll get more into that in just a little bit. The game was originally set to start at 3 p.m. and it was moved to noon, 12 p.m. as a result, partly of the forecast and because of the extreme heat that was forecast well in advance. But there were also many other partners involved, including public safety health officials, game partners, football partners from a variety of sources, as well as the Weather Service. So there were non-meteorological reasons for the move, how it was from 3 p.m. to noon, as much as meteorological reasons, many of which I'm not privy to, so I'm not going to comment on. But nevertheless, the game was moved up in part because of the forecast. And if you go to the next slide, more specifically, the forecast for the 12 to 3 p.m. time period, which would be the new time period based on the game time change, started around 91, 92 degree air temperatures, rising to about 96 to 97 around 3 p.m., which which would be when the game would approximately end. Whereas the original time, 3 to 6 p.m., temperatures are generally 96 to 97 degrees for the whole duration. So there is a little difference, but as you'll see in the next few slides, there were still quite a few impacts. Sorry, that's the slide before. Sorry. But as we expected and as we messaged, the fact that you move it up 3 hours, you're still going to have heat impacts for a variety of reasons. And the obvious one is that it's not going to be shady at a football stadium, this football stadium in particular. It was not shady at all. It was sunny and cloud-free basically the entire game in a light wind case for Central Missouri standards anyway. And because of this, and because of the surface of the field, which is essentially artificial turf, the conditions on the field were actually much, much warmer than the 95 to 97 degree highs that we saw in Central Missouri that day. We also didn't have a heat advisory in effect for this particular day, and this was a point that was noted in several newspaper articles and broadcast media stories leading up to the day. And they were pointing out that they were still expecting heat impacts during the game, but they would also occasionally, and I have not pinpointed names here to protect the guilty, but some had mentioned that heat indices were not forecast to be at dangerous, quote unquote, levels because of the lack of heat advisories or extreme heat warnings. And of course, we didn't like that particular messaging, in part because you can have heat impacts, especially at sports venues, well before you hit regional heat advisory or extreme heat warning criteria. And this was actually well known. Some broadcast news stories were pointing this out in particular, and pointing things out as specific as the type of surface on the field being an important factor. Somebody from one of the local news stations actually took a surface temperature live on the news of grass and the artificial turf at the stadium, and noticed a 20+ degree difference between the two in the early evening hours 2 days before the game, and mentioned that that might be a factor in the heat during the game. There was also a lot of messaging about preparing yourself if you go to the game. Bring a bottle of water, which was allowed for this game, and there would be water monsters set throughout the stadium to refill that bottle of water. As you might imagine, by about the end of the first quarter, the water monsters were overrun by people needing water. Approximately 30 to 45-minute waits for water monsters were occurring by the end of the second quarter. Next slide. So this is what happened, just to kind of confirm that the forecast was basically spot on for the day in Columbia. Temperatures around the start of the actual game, which was 11:54 a.m. here, the temperature was 91 degrees. That was within 1 degree of forecast. And at the end of the game was 96 to 97 degrees, which was pretty much spot on. So what happened was what we forecast. Next slide. But because the direct sunlight was still going to be a big issue because of the duration of the game, a lot of impacts still occurred. 29 medical incidents by halftime, 79 by the end of the game, as reported by a county dispatcher. Turf temperatures were taken at several points during the game. It was 126 at the start of the game, which was again at noon. It was 176 degrees by the end of the game. Concrete temperatures were measured at halftime to be over 120 degrees. So the air temperatures in the stadium, as you can imagine, were much higher than the ones reported in the shade at the airport a few miles away. Next slide. And so the results kind of speak for themselves. The coach of University of Missouri actually mentioned the 176 degree reading specifically in an interview after the game. And as reported by several news agencies, over 100 calls to law enforcement during the course of the game that were heat related, and over 30. In fact, I think if you go to the next slide, the official number from the University Hospital was 34 patients were transported to the University Hospital right next to the stadium for heat-related illnesses. And so if you go to the last slide, I think this case sort of serves as a precautionary tale, and in a few ways. Heat indices may not be the best thing to use in a sporting event as a forecast for a variety of reasons, and the lack of shading would be one of them, since of course heat indices are valid in shady conditions, but also because of the types and characteristics of the surfaces at a sporting venue like this. Of course, there could be AstroTurf or various other types of turf, amount of concrete at the stadium, protection or no protection from the wind, etc., are all important factors. Another important factor is that, or another important thing to consider at least, is the lack of a heat related weather product from the Weather Service does not imply no impacts, especially at sporting events, as I think we all know by now. And these impacts tend to occur well before these thresholds that various weather forecast offices use. And so this has informed us locally, this particular event, as well as several others from the past few years here in the Kansas City area, St. Louis area, et cetera. There's a very high profile soccer tournament happening in the US this summer, one of the host cities being Kansas City. And so we have used this event as sort of a cautionary tale as to what may happen if you hold events during the day in reasonably common heat conditions in terms of Kansas City climatology. And actions have already been taken, including the soccer matches. Original times have already been changed in a lot of cases for Kansas City to during the evening hours. But it's also changed how we message to our partners leading up to the event for this year. Using this particular case study as a good reminder of what it may only take to get widespread heat impacts for a particular case. And so the bottom line is a highly accurate forecast only takes you so far. The context of the sporting venue definitely matters. I guess that's it for me. If there are any questions.
Thank you, Chad. That was a great and informative presentation. We have some questions. So, Chad, was there any heat safety messaging during the game to athletes and spectators?
So yes, in fact, there were several public safety officials, health officials out in the stadium, in the entrances to the stadium, informing people, making sure people have water bottles, things like that. And in some cases, alcohol consumption is a big deal at these sorts of venues, and there were some pretty aggressive tactics for keeping people in the shade, or at least informing them of the dangers of going into the stadium as a result. In terms of signage or messaging like that, I didn't see anything personally, although I will state up front, I got to the game about 4 to 5 hours in advance when very few people were there. So I may not be the best person to ask that question about witnessing those things myself. But there was definitely messaging from the public safety officials at the game, one-on-one with people coming into the stadium. Moreover, there was, like I said, a lot of broadcast news, newspapers, things like that were hard messaging this in the 2 days leading up to the game, saying you need to prepare yourself if you come to the stadium. So there was a lot of that sort of campaigning going on prior to the game.
Thank you. That's helpful to know. We have another question. Has there been any studies that you know of with water being used to cool the turf fields to create an evaporative cooling effect in open stadiums like that?
I'm not aware of any myself, although this is a little bit out of my area of expertise. I would say that one thing that would be a little bit concerning is if used in a case like that is traction becomes an issue. So, and that's of course, an injury concern in something like a football game. So there's probably going to be a little push and pull as to mitigation tactics directly on the field associated with these sorts of things. But that's my speculative opinion on that.
No, that's fair. Well, looking back on the event, should have been moved further back to be played, for example, at nighttime?
So we have pondered this at length here locally at the office. And as I alluded to in the talk, there were non-meteorological factors involved in the change in time as well. I'm guessing those were involved in why the time was changed to when it was, because I think there's a prevailing notion that an evening game or even an early morning game or something like that would have been preferred versus during the most direct sunlight period of the day. But unfortunately, meteorology is not the only thing that goes into such decisions. And I'm not, like I said, I'm not privy to what all of those factors were, but I suspect that many other issues were involved that led to the game's time change. I think, though, this does serve as a good cautionary tale as the drawbacks that you can have from pushing the game for maybe 1 or 2 degrees better forecast temperatures or heat indices versus sunlight versus not direct sunlight, for example.
That's an excellent point. We have another question. Are you aware of any products in use or in prototype to help reduce heat for spectators? For example, the materials used for seating, covering seating prior to the event, and ways to help avoid sun exposure.
So, I mean, for at that particular stadium, no. If you actually go to the first slide of I took a photo of the stadium before the game, and you can see it's purely exposed and it's mostly on concrete. So people are sitting down either in very thin seats that are exposed to the sun the whole time, or may even be sitting on the concrete itself. So right now, if you're not coming in prepared for that, you may have, direct exposure or almost direct exposure to very hot surfaces if not properly prepared. I think that's something that most college sports venues need to consider in seasons to come. There are a lot of games that occur in September in areas that are climatologically warmer than Missouri. And so this is, I would say, a widespread concern at the very least.
Thank you, Chad. Thank you for your insights. For our final presentation for this session, last but not least, we will have Dr. Edith de Guzman. Dr. Edith de Guzman is an interdisciplinary researcher, practitioner, educator, and curator working with diverse audiences to understand and address the impacts of climate change in underrepresented communities. She is a University of California Cooperative Extension Specialist at the University of California, Los Angeles Luskin Center for Innovation, where her work investigates best practices for the sustainable transformation of urban areas in climate adaptation, shade access, and water management. She co-founded the Los Angeles Urban Cooling Collaborative, the Los Angeles Urban Forest Equity Collective, and Shade LA, each a multi-sectoral partnership working to make Los Angeles livable in a warming climate. Edith, the floor is yours.
Thank you so much. So it's my pleasure to join you all at the end of this particular session. And what I'm hoping to do over the next few minutes is just walk you through some of the ways in which Los Angeles has been engaging in these topics and trying to collectively work to bring more shade to these mega events. Next slide, please. So Shade LA, as you can see, we're a people-powered campaign that's really thinking about how do we take LA's mega event era to do the right thing. So we have a lot of attention and a lot of investment coming to the region in advance of several large events. We are hosting some of the FIFA World Cup matches next month into July of this year. We are hosting the Super Bowl again next year. And then we, of course, will be hosting the Olympic and Paralympic Games in 2028. So last year, a number of us came together to try to see if we could ride all of that attention to bring more shade to Los Angeles, both in and around the venues, but also deeper into the neighborhoods where Angelinos live. Next slide. As you can see, it's a very collaborative effort. We have our three organizing organizing partners here that you can see the three logos of. I represent the UCLA Luskin Center for Innovation, and our co-organizing partner and lead is the USC Public Exchange Group. who has really been doing a lot of the work to really put us out there to socialize this idea of more shade is a good idea. We have the participation from local government, including the City of Los Angeles, the County Chief Sustainability Office, our transit agency, which is Metro, the Southern California Association of Governments, and we are also working with LA28, so we have restrictions around using their logo, but we are coordinating very closely with them. And then you can see we have lots of community and impact partners. So this is something that we're doing in tandem with nonprofit organizations who are already out there doing a lot of great work, tree planting, and thinking about how built shade can also be part of the solution. Next slide, please. Now, this is not something that is completely new to Los Angeles. This will actually be the third time that we host the Olympic Games in Los Angeles. The first time we hosted them was back in 1932 when the city actually planted 40,000 palms as kind of a beautification project in advance of those games. And that is, of course, when Los Angeles became known internationally as this city of iconic palms lining the boulevards, for better or for worse. In 1984, there was an attempt to really think about how can more trees help meet some of the air quality mandates that we had. This was just a few years after the passage of the Clean Air Act. And an organization that I used to work for, Tree People, took it upon themselves to organize a very people kind of powered grassroots effort to plant 1 million trees in Los Angeles. And finally, we are now on the doorstep of this 2028 games coming to Los Angeles. And we're a different city now. We have many more people. And of course, climate change is impacting the way that we are able to recreate outside, work outside, and even athletic events, as we've been hearing throughout this session. So we're really expanding beyond just trees to include built shade as well. Next slide, please. And the things that we are seeking to do, as you can see, we have several goals. We are very focused on both expanding built and natural shade, but also preserving and maintaining what we already have. So we are not the only city and region that is under immense development pressures. And so we want to ensure that as we continue to balance things like a housing demand, we're not simultaneously doing something that we will regret later by reducing available shade. As research universities, we are monitoring and guiding progress as well. So that means really thinking about what the science tells us in order to create success metrics and then actually track how the city, county, and all of the partners that you saw on a previous slide there are doing in order to actually bring us into a 21st century that is adapted. And socializing these ideas and really helping people retrain their eyes to see their neighborhood through the lens of how much shade is there and how can they themselves be stewards of the civic resource is also a big part of what we're doing. Next slide. I'm going to share just a few examples of the types of activities that we have been engaged in the last 10 or so months, just as examples of what some of your own partners around wherever you are in the cities and regions that you represent might also consider doing. So one of the things that we've been doing is we've been facilitating a cross-agency mapping group to really think about how do different ways in which we try to track and prioritize progress for climate goals, how does that all intersect and how can we inform the ways in which we do this in order to actually bring more shade to neighborhoods. We also have been pursuing implementation funding with our various community partners. We have some state funding that was recently allocated, and so public grants and corporate sponsorships are ways in which we're really seeking to support our implementation partners to move the needle. Next slide. We have also been very engaged in both research and policy. And an example of that is that we worked with the LA City Council to pass a motion that really compels many of their departments to work toward streamlining shade. And so some of the activities that have followed after that council motion was that we did some research around how tree permitting of street tree planting actually is a sort of a barrier presently for many of our nonprofit partners, because it's a very onerous process and it really stands in the way of the city meeting some of its own goals. And so we've been putting information out there for both what the present conditions are, but also how the city and county might consider adopting different reforms in order to facilitate better shade deployment. And just in the first few months, we are now included in a number of plans. So this idea of socializing shade as a real essential ingredient in this climate changed era is something that we're very pleased is having some traction. Next slide. We're also very engaged in shade design. Many of us come from the urban forestry world, but the built shade world is one that really has a lot of opportunity for further development, both in thinking about how different solutions can fit into our urban spaces, but also how we get those to actually be permitted and allowed to happen. So we have a new shade zones competition, as we call it. This is an annual competition. We had the inaugural one happen last year. It was partnered with our transit agency, LA Metro, and got a lot of attention. And the winning design will be incorporated into Metro's kit of parts. And next year, we will be doing it again. We will have partnerships with different agencies, but we're really trying to add more concepts that can be readily deployed out there to fit different needs in different communities. Next slide. And public engagement is a huge part of the work that we've been doing as well, because again, we really need to retrain our collective eyes to see opportunities and to really understand that no matter where we are in the region, and no matter what our job or opportunities might be, this is a civic resource that each of us has some agency to impact. And so we've been out there doing quite a bit of engagement with the community. One of the more kind of fun things that I've gotten to do is that I co-curated an exhibition at our local county botanic garden that looked at how we can explore the issue of shade through art, and that engaged over 100,000 visitors over 3 months. And we were very pleased that people really resonated with the idea of taking action in order to bring shade to their own communities, whether it's on private property or working with their school, park, or business to do so. And the next slide is my last slide, I believe. I know that we have a lot of practitioners on the line, perhaps some researchers as well. I wanted to invite those of you who might have a story to tell that could be the subject of a peer-reviewed article to please check out this special issue that we are guest editing, a few of my colleagues and I, on the issue of urban heat islands and innovative solutions to fighting what many of us are having to deal with in this hotter climate. And with that, I'm happy to take any questions if anybody has any.
Thank you, Edith. That was a great and informative presentation. One question I had, I was curious about what types of expertise and skill sets and partnerships have been from this shade design process. Has it been interdisciplinary, and what has been like from your personal work experience?
Yeah, so we had, so this was absolutely partnered with expertise from architecture and urban design. So the way that the shade design competition worked was that we had students apply in teams. We had 340 students from 17 schools that applied. And we worked with the University of Southern California architecture faculty. And then the student teams were actually partnered. We created kind of a bench of experts in design firms and urban planning firms to actually mentor the student teams in order to help them produce designs that could ostensibly be built and that weren't completely pie in the sky. So we're interested in doing things that have, that can realistically be implemented in some way as part of a growing sort of toolkit of options that we can have.
Thank you, Edith. We will wrap up at 3:50, but we have one question of what were the standards used to evaluate shade structures? Like, what do you consider, for example, materials, costs, and amount of shade?
Yeah, all of those things were part of it. So the ability for it to, actually be something that could be implemented. Sustainability was a huge part of it as well. But I encourage you to take a look at our website, shadela.com. There is a design competition section, and we went through all of the criteria that students had to consider, and then the criteria that they were judged through in order to select the winners.
Understood. Thank you so much, Edith.
My pleasure.
With this, we will wrap up our session. Just wanted to thank everyone for your excellent presentations and showing these impactful heat response case studies and valuable learning lessons from them. Now I will turn it over to Kim to introduce our closing keynote for the final day of our NIHIS warm-up workshop.
Thanks, Alice. So as Alice said, it is my privilege to introduce Professor Ali Jay. Ali is the founding director of the Heat and Health Research Center in the Faculty of Medicine and Health at the University of Sydney, and an NHMRC Leadership Fellow. His research on the physiological and biophysical determinants of human heat strain has directly shaped public health heatwave policy across Australia, Europe, and the United States, and underpins extreme heat management systems for Tennis Australia, Cricket Australia, the NRL, and the Australian Olympic team. He has authored more than 240 peer-reviewed publications, co-led the inaugural Lancet series on heat and health, and leads a large multidisciplinary research group. So joining us from very early in the morning, not quite 6 a.m. in Sydney. Thank you, Ali, very much for presenting, and take it away.
Thank you very much, Kim. Can I just start off by confirming that you can see my slide okay?
Yes.
Great. Okay. Well, thank you for that introduction, and thank you for the opportunity to talk to you today. I'm going to take the next 25 minutes or so to share with you the experience that we've had managing heat stress at the Australian Open, which is a Grand Slam tennis tournament that takes place in Melbourne, Australia, every January. It's the middle of our summer, so it's always very hot. And so heat stress is always something that we need to be thinking of very clearly and developing systems to manage the risk. And I'd like to use this as maybe the way that we see this as a bit of a blueprint for managing heat stress risk in outdoor sports. So as I go through it, I'll focus on the Australian Open, but I'll try to share some of the lessons that have dropped out of that experience and how they're scalable and transferable to other settings. Before I go into the details of that, I'll just very briefly describe who I am and the centre that I direct. So I'm at the University of Sydney in Australia. I'm the founding academic director of a research centre dedicated to looking at heat and health research, called the Heat and Health Research Centre. And we organise our research according to 5 priority research themes. The way in which we look at extreme heat and hot weather is we look at it in terms of the way it impacts, and developing solutions for the way it impacts human health and well-being across the human lifespan. So we have 5 priority research themes: maternal and child health, physical activity, sport and occupational health, aging and chronic diseases, landscapes in the built environment, and humanitarian settings. And below each of those priority research themes, you'll see some dot points, which are examples of different research projects. that are underway and led by researchers within our center. By the middle of this year, we'll have about 30 researchers working full-time, dedicated to understanding the way in which extreme heat and hot weather impacts human health and well-being across the human lifespan. And what's really important about the work that we do in our center is that we don't just focus on the problem. I think a lot of people have heard a lot about what the problems are. So we're really solutions focused. So that's really the lens through which we're looking at all of these problems in this particular case. And I think the work that we did with the Australian Open is maybe an exemplar of where we've tried to better understand the problem and developed an evidence-based solution. So obviously, the work I'm going to talk about today fits really firmly in that second research theme, where we're looking at the way in which physical activity, sport, and occupational health is impacted by extreme heat. So we've worked with a variety of different sporting organizations to help them cope with extreme heat. The work in this particular area started actually in 2017 when I was contacted by the National Rugby League, who were hosting the World Cup in Australia and Papua New Guinea. And so at the time, the tournament was taking place in November here in the Southern Hemisphere, which is the getting into the hot part of our summer. And they had games that were being hosted in Darwin, in Cairns, and also Port Moresby in Papua New Guinea. And these are places that are very hot, but very, very humid. And the concern is that we had teams that were arriving from places like Wales and Scotland in the middle of their winter. And the concern was that they weren't going to be adequately protected against the impacts of heat. So that's really how that all started. And then back in 2018, we started working with the Australian Open to try to help solve their heat-related issue. In the meantime, we've worked with other organisations. We supported the Australian national team at the 2024 Olympics in Paris. And we've worked a lot with Sports Medicine Australia, and I'll touch on that right at the very end. So this was an opportunity to translate the work that we've done in an elite setting and then apply it to a grassroots setting. And we've got some exciting developments in that area. So in terms of the Australian Open, as I mentioned, it's all in January every year. It's very hot during that time of the year, but it's not hot every single day. It can be very, very hot, and then the weather conditions can change, and it can be quite cool. So it's not predictable necessarily. And actually, I'm originally from the UK, spent 10 years in Canada, and I moved to Australia in January of 2014. And within 2 weeks of arriving, it was the Australian Open. There was huge problems with extreme heat. And it was a pretty good signal that I've made the right decision to move to the right place at the right time. And so at that particular time in the 2014 tournament, you can look up some pretty scathing media coverage of this. Probably most notably the headline there in the New York Times, which always makes me chuckle at the Australian Open. It's not the heat, it's the stupidity. And the issue there was that they had, I think it was 9 first-round participants who had to retire because of heat exhaustion. That's an enormous number of players who are having to drop out because of an environmental exposure. There was also issues with the patrons as well. So heat stress risk issues with people watching the games. And so this was the background to which we were brought on board. And my good colleague and friend now, Dr. Carolyn Broderick, is the Chief Medical Officer of Tennis Australia, and she's also supporting the Australian National Olympic team as well. She was actually in LA last week for a site visit. And when she came on board, she reached out to me to ask if there's anything we can do to try to help solve this extreme heat issue that they're facing. And so in the first instance, what we wanted to do, instead of just rushing in and trying to provide a solution to a problem that we didn't understand, we wanted to step back and first understand what is the shape and the texture of the problem that we're facing. What are the opportunities to introduce interventions, changes in systems, which can change meaningfully the outcome that we're looking for. So I've been unable to join the sessions of this particular workshop earlier in the day because it's been in the middle of my nighttime. But I'm sure that the wet bulb globe temperature, which is a composite heat stress index, has probably been mentioned a few times. There's some great work that Andy Grunstein, for example, does on that area, managing heat stress risk of American football players. Is a good example of a really good application of the WBGT. But in this particular case, what we found is that the WBGT wasn't protective. And the reason was, yes, we have hot and humid conditions, but at the same time, we have exceptionally hot and dry conditions. And the WBGT wasn't developed for those types of conditions, and therefore it underestimates the heat stress risk of athletes when they're exposed to those types of conditions. What we also found is that the weather conditions or the heat stress conditions that define the risks to the athlete, they weren't measured on court. They were measured actually with a weather station, which was about 1 kilometer away. And so there was an opportunity to examine whether that is something that could improve our management methods. Another thing, just philosophically as well, is that what was clear is what we know is that the heat stress problem is, yes, it's hot weather, but the root of the problem is the hot athlete in the hot weather. And hot weather doesn't necessarily translate directly to the hot athlete in different ways. So we wanted to start thinking about how we can implement a different type of system that estimates how hot the athlete's going to get in response to the conditions and the activity and the clothing that they're wearing in order to make evidence-based decisions. Another thing that was very obvious is there was no clearly accessible framework for decisions. So players and stakeholders felt that they were in the dark. There was lots of rumors that would fly around that which gave rise to conspiracies that certain players were being preferred or to others in terms of the decisions that they were making as to whether they should close the roof or suspend play and things like this. So we wanted to make sure that it was accessible and visible. I think that's a really important thing that we've learned, is that that's what it gives us the greatest credibility and confidence of the athletes and the participants, is that they can see what the heat stress risk is at that time. We provide a forecast, and they understand what the framework of the decisions are. It's all stated up front, and it's all based on science, which really, really helps. And finally, with the WBGT, the layperson typically finds it very difficult to understand what on earth it is, not just in terms of what WBGT stands for, what makes it up, but also the units are in degrees Celsius, or degrees Fahrenheit, which is very confusing because air temperature is given in the same units. And so and a relatively low WBGT number is actually quite harmful relatively if you compare it to an air temperature number. So that also was an opportunity to develop some clarity on the system that we were doing. So we introduced the policy for the first time in 2019, and I'll talk you through the process of developing it. So I'll start off with the 5 kind of goals that we have with it. So we want to develop a tennis specific heat stress scale. Now, it's tennis specific in that it takes into account the duration of exposure, the intensity of activity in terms of metabolic heat production, and the type of clothing that they're wearing. But this is eminently possible for all sorts of sports, and we've done it for rugby, for football, for all sorts. So this is all very simple. But in this particular case, we wanted to make it tennis specific because it's a tennis tournament. We wanted the scale to be really simple and easy to understand. We wanted to have a graded evidence-based heat countermeasures. So this kind of focuses on the idea of it's not just having a dichotomous decision of yes, carry on, or stop because it's too hot. It gives us an opportunity to introduce graded interventions that as the heat stress risk escalates, we can implement controls to try to focus on keeping the athlete cool despite the hot weather. And ultimately, this has been successful because it's allowed us to push out the maximum conditions under which we actually have to recommend the cancellation of play. So play now continues more safely for longer under conditions that previously they were probably suspending play. We wanted to take into account the physiological restrictions to heat dissipation. That's really important. So let's get a little technical, but the reason that's important is because the WBGT performs well under humid conditions, but in very hot and very dry conditions, it doesn't pick up on the fact that the climate is no longer being the thing that restricts how cool you can keep yourself. Is how much sweat you can produce in the first place. And so we wanted to introduce that aspect to the model that we were using. We wanted to customize it for tennis activities, as I mentioned before, and we also wanted to look into ways in which we could implement on-site heat stress measurement conditions. So I'll go through each of these and explain why we made the decisions that we did. Okay, so first of all, what does this? How do we lay out this scale? How is it simple and easy to understand? So we figured that we'd landed on just a simple 1 to 5 scale. Why a 1 to 5 scale? Well, we see them all the time. people are familiar with this type of grading system. You see them on fire scales. And in fact, I was inspired to actually go with this when I was on holiday about 2 months before the first Australian Open that we serviced. I was thinking, what type of scale should we be doing? I need to make a decision. And I was driving through the South Island of New Zealand, and there's a fire scale. And when I saw that, that's just such an obvious decision to make. So we're used to seeing it in that regard. We rate things out of 5 all the time. Movies, hotels, Uber drivers. So this is it's a risk framework, or a grading framework at least, that everybody is going to be familiar with. And then you can then attribute a certain level of risk to each of those particular categories. So the way it worked is that if it's a 1 category, the risk is low and there's no additional countermeasure necessary. When it reaches a 2, this is when it's a moderate risk, and we recommend that athletes start to hydrate ahead of thirst. This is really important because we know that the thirst mechanism has a bit of a null zone. So by the time you feel thirsty, you've probably lost around about 0.5 to 1% of your total body mass in body water storages. And then trying to recover that lost body weight from a hydration status through drinking water by the time you feel thirsty is very difficult to do. So you're kind of behind, you're in a lag already. And so we wanted to encourage athletes to try to stay ahead of that lag, so not waiting until they're thirsty. So this prompts them to do that. It also enables the organizers to be adequately prepared to deliver more of what we're recommending as well in advance. When we reach a 3 on the heat stress scale, this is where we implement active cooling strategies from the start. I'll talk about that very briefly, very shortly. When we get to a 4 on the scale, this is where we start implementing rest breaks. So because it's a Grand Slam tournament, there are 5 sets per match, a maximum of for men, 3 for women. So we do it approximately the halfway point. So after the 2nd set for women and after the 3rd set for men. And if we reach 5, eventually, this is when the risk is so extreme that we recommend the suspension of play. And at the Australian Open, there are 3 stadium courts that have a retractable roof. So on those courts, what they do is that they close the roof and they turn the air conditioning on. So that's the last resort, because the Australian Open is an outdoor tournament, and the focus needs to be on trying to make sure that play can continue safely in an outdoor conditions. Do you want to briefly go back to that level 3 on the heat stress scale? This was an opportunity to deliver evidence-based science. So one of the things that was really obvious back in 2017 when I first got involved with the Australian Open is that, you can even observe it on the television, is that during the rest breaks, players were adopting a variety of different cooling strategies. I remember seeing Maria Sharapova with this necklace of ice cubes and thinking, wow, that's not really going to do very much. And then you have other people using boxes or hand fans. And so what we wanted to do was make sure that we're relaying the latest science to the athletes. And so we actually done some studies ourselves where we'd simulated the Australian Open conditions and the US Open conditions, and they're published in these 2 separate papers. So this was looking at what the optimal cooling strategies would be for players under Australian Open conditions, led by Grant Lynch. And what we did is that we simulated a tennis match in our climate chamber at the University of Sydney in terms of the duration of the games. We implemented breaks every odd numbered game. So it simulated the rests that the players had. And then we wanted to systematically test, okay, which strategy works the best at reducing how hot and how difficult the activity feels to the athlete during these breaks of this simulated tennis match. And we simulated a 4-set match so we could see the effect. And what we found that dropped out was really effective was these ice towels. And so these are 3 kilograms of crushed ice wrapped inside of a towel, which is damp. You wrap it around your neck, and it really gets a strong cooling stimulus to the neck with a high surface area. And we found that was sufficient, a very strong cooling stimulus during this short little window that the athletes have. They have about 80 seconds before, because they've got to walk to and from the baseline and sit down. They've got 90 seconds to do that. So they get about 75 to 80 seconds every odd numbered game. And so we want to know, what can you do during that small window to reduce the athlete's core temperature as much as possible? So we found that was really successful under Australian Open conditions, which is high as 44 degrees Celsius and 6% humidity. So those are the conditions in 2014, the extreme ones. And we also did it, this is another paper that we published in Medicine, Science, Sports and Exercise, which basically asked exactly the same question, but under the US Open conditions. So 36 degrees Celsius and 55% humidity. We also have solar lamps in our chamber which simulate the direct effects of solar radiation, and we found essentially the same thing. So we've got the scale, and the question is, how do we deliver the scale in a way that looks good and resonates with the athlete? So this is where the experts take over the Australian Open and their graphic designers developed the first version of the Australian Open heat stress scale. It looks a little different now, but it's pretty similar. This is the first basic version. So we've got the scale and what it looks like. So the next question is, what kind of number do we issue? And so, first of all, we start off with a scale, and it's got a 1, 2, 3, 4, 5, a full number. And we started doing some discussions with some stakeholders, trying to get a sense of whether that's enough information or whether we need to give some more information. And so, what really was obvious is that, let's say, if we gave a 3, yes, that category is high. That would trigger the cooling strategies. That works really well. But this number is always changing, or it potentially can change. And so we wanted to know whether the athletes wanted higher resolution information than just a whole number. Because if it's a 3 category, it could be right at the low end of the 3 category, or it could be right at the high end of the category. And the player would want to know if it's really on the cusp of potentially going into a 4, because then they can mentally prepare for the potential of having a break in the middle of their match if it happens. So what this gave rise to is that it was obvious that there was a lot of utility in having a decimal place added to that number. So we issue the number not just as a full number, but to 1 decimal place. So we give it either a 3.1, which shows you that you're at the lower end of that category, or a 3.9, for example, if it's really about to tip over into a 4. And that adds a lot more information. It's probably pretty obvious to most people that are listening to this, but that was a process that we needed to go through trying to understand. And this is even more important when you're at the very high end of the scale. So you could have a 4, and that could mean anything, but it also means that you could be actually getting really close to having to suspend play. And so that is something, or put the roof over or something like this if you're on a stadium court. So that was very clear as well. We wanted to give a decimal place because it really gives you that information on how close you are to that particular threshold. Okay, so we've got the scale, we've got the number, but then the question is, where does the number come from? So I'm just going to go through that. So there's a lot of focus on temperature. I'm sure it's been said many times by the experts that have been on this part of this workshop for the last 2 days. But there's one thing that I'd like people to take away from this today is if everybody can go away understanding that the temperature that is reported on the weather forecast, that the temperature that's reported on your phone, on your app, that is measured in the shade. It's not the temperature in the sun. You have to measure the temperature in the sun with another device called a black globe thermometer. And that takes into account something called mean radiant temperature. And what we know is that the way in which hot weather impacts hot people is that the environment is defined by 4 different parameters, not 1, not temperature alone. Ambient temperature in the shade is, of course, one of the key parameters, but also the humidity. Of course, high humidity impairs the ability of sweat to evaporate when we're exposed to conditions of 35 degrees Celsius, 95 degrees Fahrenheit or higher. Once we go above that, the only way in which you can physiologically cool is by evaporating your sweat. And the ambient humidity is a massive driver of the ability to evaporate that sweat. As I mentioned, if you're in the shade or if you're in the sun, that makes a big difference. So we measure something called mean radiant temperature. Jenny Vanos was part of this. Later on, she's done a lot of work looking at different ways in which we could characterize mean radiant temperature. And that takes into account the additional thermal load that the body has to be the body is subjected to and has to tolerate and cope with, in addition to the heat load that's represented by the ambient temperature. Then, of course, we'll be familiar with the sweet relief of a breeze on a hot, muggy day. This is because air velocity also influences the way in which an environment impacts the human body. So when it feels cooler when you get that breeze, it's not because the air is cooler, it's because it's encouraging more sweat evaporation or more convective heat loss, depending on the other parameters. So all this to say is that when you're characterizing the hazards, the heat hazards, so the heat stress environment, you need to measure 4 fundamental parameters: temperature, mean radiant temperature, humidity, and air velocity. Now, there's also composite heat stress indices like the WBGT and others that take into account these parameters to either a full extent or a partial extent. But that's probably a deeper discussion for another session. In addition to the hazard, of course, it impacts different people in different ways, fundamentally based on 2 personal parameters or exposure parameters. This is basically what people are doing and what they're wearing. So what people are doing determines their rate of metabolic heat production, so how much heat we have to get rid of in order to keep cool, and also the clothing that they're wearing, because clothing serves as a barrier to evaporative heat loss or heat transfer at the skin surface. So the main thing that we're concerned about in the heat is actually clothing that impairs the ability of sweat to evaporate through that fabric to the environment. So this is something called evaporative resistance. So you combine these 6 things, and what we do then is feed it into a physiological model. And the reason that we use a physiological model is because that's the basis of deciding how hot is too hot or when we should intervene. Because the leading issue is the athlete overheating internally and the strain that's generated inside the body, then that triggers the concern. And so we use this model, we feed in this information, we then estimate some physiological parameters. Very basically, how hot the person is going to get, so their core temperature, we can estimate that, so their hyperthermia risk. How much work their heart has to do, that is in a public health setting, that's very important. In an athletic setting, it's less so, but also their rate of dehydration as well. So, for example, you can be physically active in a very hot, dry environment, and your core temperature could be maintained quite well, but at the cost of having to produce and evaporate an awful lot of sweat. So the rate of dehydration in that case would be great. So we estimate these outputs, and then we compare these outputs to what we know is safe or unsafe. And based on that, we integrate that information and then issue a overall heat stress risk score. And this is really the fundamental basis of what we do at the Australian Open and in other settings as well. So people would say, okay, well, so you've got your framework there, but what model do you use? And so I just showed this. I don't expect people to read this, but this is a paper that was published by Dusan Fiala and George Havanith. So George was my PhD supervisor about 20 odd years ago, 25 years ago, my goodness. And they published a paper back in 2016, which really describes how many heat stress models are out there. And this is just a screenshot of 2 pages from that article. And I'm not going to show all of them because it'll be definitely boring, but just to know that there are over 150 different heat stress indices that are out there. So we don't necessarily need to build a new one in this particular case. What we can do is repurpose existing heat indices for the setting that we're using. And so in this particular case, we chose 2 on the Belding and Hatch heat stress index and the PHS, which is the predicted heat strain index, which is an ISO standard. We combined them to try to understand, to estimate hypothermia risk and dehydration risk. So we've got our scale, we've got, we understand how we're going to display it and how we're going to issue the number. We've got our fundamental model. So the question is, based on what information? So you can have the best model in the world, you can have the best framework in the world, but if you've got junk coming in terms of the inputs, you're going to get junk coming out. So it was really important to us that we really focus on getting high fidelity, high quality, representative environmental data into the model, so we're issuing something that makes sense. And so this is a schematic of the, just from Google Maps, of what it looks like at Melbourne Park, where the Australian Open takes place. And what I've highlighted here in the red circle is the Bureau of Meteorology weather station, which was used to issue the heat stress advice for the Australian Open before we got involved. What's really, so play takes place here. Here's Rod Laver Arena. Pretty big complex. This is Melbourne Park. This is MCG, which is Melbourne Cricket Ground. That's off the campus. So this is kind of really where it all happens. So it's about 1 kilometre away. It's also stationed next to the Yarra River, which kind of influences humidity a bit as well. So we wanted to look into different ways. So back in 2018, the first time we got involved, we said, okay, well, let's start measuring the conditions courtside and compare them to what we've measured by the Bureau of Meteorology weather station. And what we found, we got very different conditions. And the way we did this in 2018 is that we deployed just some simple Kestrel heat stress monitors, with a lot of people on this call will be familiar with. They did a good job of just giving us a feel for how different it potentially could be. But one thing we found with these devices is that they were very unstable in terms of the conditions that we were getting. Particularly in conditions where you have still air and then you have gusts of air thereafter. And you get that a lot in these stadiums. And especially because they're small devices, they heat up really quickly under the very, very intense sun in Australia. And what we found, we were getting 3 or 4 degrees Celsius fluctuations in air temperature within seconds. And so I've got kind of, the Craig Tiley from Tennis Australia, texting me and saying, or it was Craig Tiley or it was Tom Larner at the time, texting me saying, how hot is it? Because that was informing their decisions. This is before we implemented our heat stress scale. And it was very difficult to give them a definitive answer, because literally in front of my eyes, this device was changing its temperature by the second. So when we got involved in actually delivering the heat stress scale and the heat stress management system, I didn't want to be beholden to this variability. I wanted to know how hot it was, not approximately how hot it is based on these other factors of the environment. Important to keep in mind that those 3 to 4 degrees Celsius fluctuations in temperature were not real changes in temperature. It was just changes in the device that was measuring the temperature. And we've seen this repeated across devices. So Kestrels work really well in certain settings, but they weren't fit for purpose for what we were doing in this high stakes setting. Another thing that was really important was making sure that we could deploy multiple of these devices and actually get that data from those devices in real time and channel it towards a dashboard to enable simple decision making. So what we basically decided was to develop our own devices. So we developed something called the EMU. And an EMU is a flightless Australian bird, but also the Environmental Measurement Unit, which we've developed at the University of Sydney. And I like to call this slide the evolution of an EMU, because it shows how dramatically this device has changed from when we first deployed it in 2019 to the present day. So the one on the left in 2019, this was very rudimentary. It gave great data, but it is basically a wooden box that was manufactured by John Eisenhuth, who's my colleague here at the University of Sydney. And we've got our wet bulb sensor. You might look at that yellow pot there and might think, oh, that looks like a urine cup. And that's because it is a urine cup. But we simply just filled it with distilled water to be able to saturate the wet bulb. So we used that for measuring humidity, we measured radiation, wind speed direction, and we had great air temperature measurements. But of course, that's not a sustainable solution, walking around with things that look like that. So we transitioned to something looking a bit more scientific in 2020. That was interrupted by COVID, of course, but we still delivered it every year. And but that still looks a little dodgy because you got all those wires kind of coming out. So eventually we worked with a product design company called 4Design and developed a device on the right hand side. And that's our current EMU, which looks a lot better, I think. So this is what it looks like. We measure temperature and humidity. We measure mean radiant temperature or black lobe temperature to develop mean radiant temperature, wind speed and direction. And one of the things that also came up during the bushfire crisis of 2019-2020, Black Summer, as we call it here in Australia, were concerns around air quality because of particulates. So we also, in 2020, added an air quality monitor as well, which measures PM 2.5, PM10, and also ozone to enable decisions to be made around air quality as well. There's interactions between heat stress and air quality as well. And we also designed it to the point where now you can actually collapse it in a carry case. So this was in conversations with people on tour. So if they want to take these devices and carry them around, they need to be able to put it in overhead baggage on planes. So we've developed that as well. So the way it works at the Australian Open is that we actually deploy now 5 EMUs across the Australian Open. We have the 3 dots in red are the stadium courts. So we use that because they have very distinct micro environments. The conditions in Rod Laver are different to the conditions in Margaret Court Arena, even though they're next door. That's because the architecture is different, the wind flows are different, the sun exposure is different because of the angles and the orientation of it. So these are things, and the capacity is different as well. So we wanted to measure that. And what we found on the outer courts, you don't need one on every court because broadly they're very similar, but we have western courts and eastern courts. So we wanted to have a device on each of those. And we have a central command center, and this data gets fed instantaneously to that central dashboard. Now, back in the early days, I used to be there myself. Now we run it completely remotely. We just provide a dashboard to the chief medical officer and the head referee, and they can just see the feed of the data. We can also plug it in with an API into their existing systems, and they just see the data. And it makes it very simple and intuitive to interpret and then subsequently make the decisions on. We just provide advice, they make the final decision. So the type of dashboard that we provide to the end user looks a little bit like this. This is an example of one of the dashboards that we use, where you've got that risk value, where you've got the escalation of the current risk. Then on the top right, we've got the data that's coming from each individual sensor that they may be interested in. And we also provide a 12-hour forecast. On the bottom right, we have the recommendations. In this particular case, it's relatively cool. It's a cool day. We're pretty low on the scale, so there's no recommendations. One of the things we also learned was that when we're issuing the number to the athletes, we weren't too sure if they wanted other information. And after about 2 days of doing it, and the first time we deployed it in 2019, what we actually realized is that the players don't care what the temperature is. They wanted to know what the heat stress scale number was. And that was a really, really strong signal of the uptake and the resonance of our method with the athletes, which was very satisfying indeed. So this is what it looks like at the Australian Open. These are publicly displayed. Well, they're displayed to all of the player areas. So these are in the gyms, in the changing rooms in the public areas or the grouping areas. We also have this scale displayed in the media center as well, because the media get very interested in this. So sometimes it does get quite surreal when I have kind of Pam Shriver talking about our heat stress scale that we developed in my office back in 2018. And then you've got the recommended controls as well. We also provide some app-based support as well for the stakeholders. So we provide the same dashboard with the time stamp on an app, which enables them to see live across all. And we have five of these different heat stress scales, and you can see the trajectory of it as well. So that proves to be very handy. One thing that we did this year was actually provide a longer term forecast. So one of the things that the organizer were concerned about were 2 days that we had that were forecasted. It was very, very hot. And they wanted to really understand how long would the heat stress scale exceed that 5 threshold at which they'd have to suspend play. And is there anything they can do to adapt to maybe recover as much of the playing time as possible? Because it was quite clear that we were going to reach a 5 on both of those days, both on the 23rd, I think, and the 24th. And so we did this 8-day forecast in advance. And what they could see is that play would be probably suspended at around about 1 p.m. on the 23rd. And normally play starts at 11 a.m. And what they wanted to do, because it was going to be probably above that 5 for a few hours, they wanted to see if there's ways in which they could shift play. So based on this information that we gave them as a forecast, they were then able to utilize that information and then change the scheduling. So they made this call to actually start play earlier on that particular day to prevent too much lost play. So that's a way in which organizations can adapt to the conditions if they have a bit of a heads up as to what types of conditions are coming and how they relate to their decision-making framework. So I'm out of time, but I'm just going to finish off with briefly describing the way in which this work in what is I think fairly said, a pretty decadent setting, high level elite millionaire athletes competing in very hot conditions. Yes, many of us are fans, but maybe there's a relatively low level of sympathy for millionaires having to tolerate these conditions. But we can take the same principles of the work that we've done with elite athletes and think about ways in which we can translate it to recreational sport, community sport, and grassroots sport. So to this end, we partnered with Sports Medicine Australia, which is the governing body of sports decision-making in Australia. We developed for them a new extreme heat policy called the Extreme Heat Risk and Response Guidelines. The underlying paper, the academic paper, is published in the journal called Journal of Science, Medicine and Sport. That's the flagship journal of Sports Medicine Australia. And so that's freely accessible. And so anybody interested in that can take a look at that paper. But the guidelines document is more targeted at the layperson. And one of the things that we wanted to do was think about ways in which we could deliver this information really easily to everybody in Australia. And so to that end, what we've done is developed a freely accessible web tool, which we're in the process of turning into an app. So very briefly, we cover 40 different sports, different clothing levels, different rates of metabolic heat production, different exposure durations, and you can select from the sport at the top there. You state your location based on your postcode. It draws on freely available weather data, and then it issues a heat stress risk score on a 4-point scale, because that was simpler for the general public. And it provides key recommendations. We provide a 7-day forecast as well. So I'm just going to finish off by just showing, hopefully this will work. So this is just an animation of the way it works. So the QR code on the bottom left-hand side, you can scan that to go straight to the tool. It's freely available. And what we're actually doing is we've now made it available internationally. So anybody can use this in any country. We think we have most countries covered. The US is covered, for example. And so what you do is that you enter the sports, your location, so your zip code, draws on the local weather information, tells you what the current heat risk score is, and it gives you the 7-day forecast with an hourly forecast. So it helps you understand what level of heat stress risk your sport is going to be exposed to at different times. And it helps you then better prepare as well. You can install it on your phone as a native app. And we're going to be working on scaling this up to a proper app as well. Again, just to emphasize, this is freely available. what we're really interested in is impact and delivering our research to as many end users as possible. It's not perfect, but it's something that we've been working through, and this tool and this emergent app will then evolve in the coming months as well. So I encourage people to check it out and let us know if you're interested in helping develop it further. Then very finally, the question is then, if we're talking about the athletes, what do we do for the patrons? And so we've also done some work looking at public health intervention. So using the same type of digital intervention to help people in the general public. So when you're looking at athletes, it's one thing. When you're looking at the general public, it's an entirely different thing. Because what we know is for athletes, it's actually relatively straightforward because they're a pretty homogeneous bunch when it comes to how heat acclimated they are, how fit they are. Even their body sizes are pretty similar within sports. It's a little different for different sports, like American football. You have quite a lot of variability in their body size, but still it makes it relatively easy to make pretty accurate predictions. But on at the public health level, you've got all shapes and sizes of people, and this is what happens when people attend events. And so what we've done is develop this thing called Heat Watch, which is a similar idea where it's a web tool, but within it you create a personal profile. So you create up to 3 personal profiles, and when you create this personal profile, you let it know how old you are, whether you have a chronic disease, whether you're on a certain type of medication, and other questions, and it creates this profile using this physiological model, and then it draws on the latest weather data in the location that you're in, and then it gives you a heat stress risk score for you. It's an individualized heat stress risk score for you. Again, on a simple scale, this one's a 6-point scale. And then what we do then is have the graded interventions, and we use it as a platform to deliver evidence-based advice. Again, we provide a 7-day forecast. This Heat Watch tool is only available right now in Australia, but we're working with other organizations to try to see if we can scale this up. At one stage, we were in discussions with European Football Championships organizers for Germany in 2024 to see if we could develop a version like this for patrons as they're attending the game to help manage their heat stress risk. That didn't actually happen in that particular case, but that's a good example of the type of situation where this could be used. Anyway, I'll finish off there. I think I went a little over time, but thank you for your attention. Again, there's the QR code for the heat risk tool. Just want to acknowledge my colleagues, Carolyn Broderick, James Smallcombe, Federico Tartarini, Grant Lynch, and Troy Cross, who have all helped with this work. And I'm funded personally by the National Health and Medical Research Council of Australia, and I just want to thank them for their support. Back over to you, Kim.
Thank you, Ollie. Thank you so much for that really in-depth look and covering a whole variety of topics within what we've been talking about the past 2 days. Spectator health, obviously athlete health, different microclimates, different heat stress indicators. So thank you so much. And unfortunately, we don't have time for questions, but as we bring the NIHIS heat season warm-up workshop to a close, I want to thank you all for your time and dedication over the last 2 days. And we began this journey by examining the nature of the problem and the physiology of heat. And we're ending it with a robust toolkit of strategies, legal frameworks, and real-world case studies. A special thank you to our closing keynote, Ollie J, and to all our incredible presenters and moderators for sharing their expertise from the front lines of road races to planning of the 2028 Olympics. With that, I am going to pass the floor over to Morgan.
Thanks so much, Kim. I want to extend our sincere gratitude to Duke University Nicholas Institute for hosting us in this virtual space and ensuring that everything ran smoothly today and yesterday. But I also want to thank everyone that helped pull off this workshop. Our NIHIS Workshop Planning Committee worked tirelessly over the past few months to make sure that this event could happen, and we could not have done it without them, and with a special thanks to Barb Bousted and to Lauren Ballatin. And over to you, Arthi.
Thanks, Morgan. Our final thank you to all of you, our attendees, whether you're a meteorologist, athletic coach or manager, a public health official, emergency room clinician, or an event or emergency manager. You are the ones who are going to take these science-based strategies back to your communities. And because of your commitment, more athletes, workers, volunteers, and spectators will be safe this summer. To you, Paul.
Thanks, Arthi. And I hope everyone had a productive couple of days attending this workshop. As a reminder, the recordings of the sessions from today and yesterday will be posted on heat.gov. You can also check out heat.gov for additional resources, data, and guidance. Let's take these actionable strategies and make this a safe and resilient heat season for everyone. I'll now turn it over to Lauren to go over a few upcoming events and close us out. Lauren?
Thanks, Paul. So just a few quick closing slides. Thanks to all the panelists. But again, this workshop was hosted by the National Integrated Heat Health Information System, NIHIS, with support from Duke's Nicholas Institute for Energy, Environment, and Sustainability. So to close us out, I just have a few quick slides to touch on some other upcoming events that NIHIS is hosting. So first off on the slide, you can see we're hosting Heat Safety Week from May 18th to 22nd. This is our annual social media communications campaign to raise awareness about heat risk. And throughout the week, we and our federal partners are going to be posting heat safety information on our social media channels. And this year, we also have a lot of non-federal partners participating, from state and local governments, nonprofits, private sector organizations, and even people on the individual level. So would love for you all to get involved. We have a webpage for this event, which we will add in the chat. And there you'll be able to find detailed information about how you can get involved. And we have resources like social media toolkits and graphics that you can grab. So check that out. And next slide, please. Next up, National Weather Service and the Centers for Disease Control and Prevention are co-hosting a Partners and Users Heat webinar on May 18th from 2 to 3 p.m. Eastern Time. Morgan just put the link for that in the chat. So this webinar is going to bridge forecast data and community heat preparedness, discussing topics like heat safety graphics, heat risk, and the new probabilistic heat risk prototype, as well as other heat tools. So it's open to the public, looking at media, emergency management, federal, state, tribal, and local governments. So do register for that if you're interested in attending. Next slide, please. And NIHIS is housed in NOAA's Climate Program Office in the Office of Oceanic and Atmospheric Research. And so we've been working with teams across the office to organize this webinar series all about heat research. So our next upcoming webinar is on May 21st at 1:00 p.m. Eastern. It'll focus on urban heat research. So we have a really great lineup of speakers, and just encourage you all to scan the QR code or check the link in the chat to register. And we also will have a link in the chat for information on the webinar series as a whole. So that's where we post recordings if you want to go back and watch any of the past webinars for the series, or if you want to keep an eye on it to see when registration will open for the next few webinars. And then last slide, please. And finally, I just want to share some information on how to stay connected with NIHIS in general. We have a website, heat.gov, where we post comprehensive federal resources related to heat. So check that out. And then we also have a newsletter called the Heat Beat that we send out with lots of news, events, and opportunities in the heat space. So that's another great way to get updates. And then finally, we have an account on X where we post as well. So do feel free to stay connected in any of these ways. And now I have the privilege of closing out the entire workshop. So this has been said, but just reiterating how thankful we are for all of the panelists who joined us, all of their great presentations. And we're really glad to see how much interest there was in this topic, especially as we head into the warmer months. So thanks again. Thanks to you all for attending, and hope to stay connected and see you at a future event.
I think we're all set now.
I don't see, oh, there's one open. Oh, no, just a thank you. Okay. I think all the Q&A has been answered.
All right. Thank you all so much.